Sorry, the online participants can't hear anymore.
So the big different for those new things about adoption and how you can be impactful in our intervention that should bring to the same. Thank you.
That's a beautiful one from the Corona management system. Thank you so much for that good message. Now, also present with us is representative of the Malaria Consortium to bring in delivery message. So permit me to call on Dr. Icammda to please give a delivery message on behalf of the Malaria Consortium. Please join me to welcome the trade.
Once again, good morning, everybody. I think I'm standing on the biggest array. This is supposed to be our senior country technical coordinator for sure. So now she's not there, so I'll just stand there for. I want to thank Icammda and Simon. Thank you guys are doing great work with mathematical modeling. For me, I've been part of, just like my brother said, I've been part of the people trying to avoid everything about modeling. Calmly trying to avoid, even when Prof will be chatting me, send me a mathematical data. I said, no, avoid me. But something happened like 3 months ago. I went to enroll in a free course, a free master's course, and the course is all about climate change mitigation. And just like that, I found myself doing geospatial modeling like that, and it became interesting. So one thing I want us to take home here is nothing is a waste. No idea, no learning is a waste. Let's try to take everything and anything we can. Boom. I was happy when I saw Prof. Yes. Maybe Prof will not recognize me, but yeah. So all these things are for somebody of their nature to also come to learn. I think it's something we should also take very seriously. So I want to welcome us, and I will also implore us, take everything, every detail. When we don't understand, personally, I will be the person championing for questions. So all of a sudden, I found myself doing something that I'm not used to. Me that I used to be an entomologist, chasing mosquitoes. Now I'm trying to see a way of aligning it with climate change, forecasting climate change, looking at outbreaks and all that. So I'll implore all of us to take home and take everything seriously. So on behalf of Malaria Consortium, we also want to welcome you all and say thank you for coming. Thank you.
All right, thank you so much. Yeah, Dr. Ebuka was chasing mosquito before. Now he has to do modeling, and he's still chasing. He's one of the. I think you chasing mosquito. I just wonder sometimes the effort we put in with this thing called mosquito. You know, somebody has to dedicate a whole of his life chasing mosquito. You know, that's a great one, isn't it? He went to school to learn how to chase mosquito. Dr. Ebuka, well done. Thank you for chasing the mosquitoes. And just right away, while we were having the good message from MC, we have the big president and minister also coming in. Dr. Resena is here already, and we want to welcome her. Please let's welcome Dr. Resena. All right, so while passing the mic, I didn't introduce somebody, and nobody asked me that I didn't give mic to somebody. Yeah, I didn't give mine to somebody just because I don't want him to just mention his name just like that. So today we also have the privilege of having with us the director of the International Center for Applied Mathematical Modeling and Data Analytics with us, who is going to be instrumental, to what we are going to be learning during this workshop. And it's no other person than my own professor, Professor Emmanuel Olabi. Yes, to say. All right, thank you. Now I will at least allow Dr. Resola to say hello to us because yes, I've waiting already. Okay. Thank you, man. I will allow Dr. Resola to catch our breath. Breath, sorry, for breath. And because we can't be here if she and being the big person here in this room has not put this together. Bringing us to Abuja is not is because Dr. Resner is here and has done a lot to ensure that this is going to hold. Many of us have heard somebody say they traveled from Latvia, somebody from different places, and see the online participants. So this is coming to a reality because somebody has been working and has ensured that this kind of thing is put together. So please join me to welcome her. Just say hello to us. Yes, Dr. Rekena, please stay away from.
Good morning, everyone, and I do apologize for coming late. I needed to do one or two things before joining the meeting, but I'm excited to be here, and I really want to welcome you on behalf of the West and Central Africa Program Director for Malaria.
These guys are already here.
We are glad to be having this meeting. We believe
Nmep.
very strongly in capacity building at the Malaria Consortium. We are a member of the One Kind Consortium, that is the West African mathematical modeling capacity. That's consortium that is building capacity in the West African sub-region and retaining that capacity there for mathematical modeling to support, disease control in West and Central Africa. And our role on the consortium is to bridge the gap between the academia and the program. Because we do believe that a lot of things go on in the academia that sometimes at the end of the day, they just become like academic exercises that have no relevance to program. And so our role on this consortium is to bridge that gap, to bring the program close to the academia and ensure that whatever research is being conducted in academia is relevant to the program, and those research can be translated into policy. They can, help to answer questions that the program really wants to answer. So that way, it's not just an academic activity. And I think this is the whole essence of this capacity building on models, infectious disease modeling, and particularly malaria and the entities. And we're excited to be part of the consortium. We have been working with Icammda to, strengthen that bond between the program and the research institute. And we believe as we build this critical capacity, critical mass of capacity in the country and even in the West African sub-region, it becomes easy for these programs to leverage on those capacities and be able to use it to improve decision making for programs, and also be able to achieve the impact that they're all looking to achieve in this. So again, I welcome you to this meeting. I do believe that Icammda is they've been in this, they've been holding several of these workshops, and we believe that this Abuja um, edition, we are collaborating with them to bring it to people so that we can also allow people in the northern region to participate in it and have the capacity residents also in this region. So thank you so much for coming, and I wish you all successful journey. Thank you.
All right. You can imagine that she was just calling and I just handed my over to her. If I would allow her to take more time, maybe I mean not you know the kind of thing that you have gotten. So that's a very wonderful message from our own mother to us actually. Joyce. Thank you so much, ma, for the very message. With us here is also the National Malaria Elimination Program, the National Coordinator. I don't know if we have the representative already to give us the welcome address of the National Coordinator. All right, NMEP, are we there? As NMEP representative, can we have you?
It's online. Is it coming up online?
Yes, online. Mr. Abuja.
It's tough. Super social.
He's talking, it's muted.
Please, if you are talking, you are muted, Mr. Oyebuchi. Okay, so while we are waiting for the NMEP, we want to quickly run through the objective of this meeting, and I'll call on again Mr. Simon
Can
again
you
to
project this?
do that for us.
Mhm.
Mr. Simon,
Objective, yeah.
please, you will
This one.
take us through the objectives of this meeting. You are welcome. Thank you very much. Good morning once again.
I'll be taking you through the objectives of this meeting today. 2 days workshop on malaria mathematical modeling and public health analytics. Meeting objective. Objective number 1, we hope to take you through introduction to malaria mathematical modeling. Participants will understand the fundamental concepts and application of mathematical malaria modeling, and we'll also be exploring the types of model and their uses. That takes us to objective number 2, which is the data-driven modeling. And under this title, participants will understand data quality and availability, learn to integrate data into malaria models, surveillance, and intervention coverage data. We'll also take you through modeling for public health decision making and analytics. Under that, participants will explore scenario analysis and predictions. We'll also learn how to apply modeling to inform malaria elimination strategies and policy decisions, as well as understand analytics application, learn to interpret and visualize our data. And finally, objective number 4 will be taking you through capacity building and collaboration. We hope that this workshop will foster collaboration between modelers, researchers, and policymakers. We also hope that at the end of this workshop, we will strengthen local capacity for malaria modeling and analytics. Thank you.
All right, thank you so much. So, having a glimpse of what we stand to learn, we see that it's a whole lot, and we really want to maximize these 2 days to achieve also. We can't do that except our operations. And so we are really pleading and then asking that we all work together to get this achieved. That would mean that when it's time to go for break, we all go for break. When it's time to return, we all return. And when it's time to work, we all work. All right, thank you so much. I wouldn't know if the NMP is around now. Mr. Awebuchi.
He's stuck.
You may unmute yourself, Mr. Awebuchi.
I think he's speaking. Okay.
Let's see.
What's happening? I'm totally speaking, but we can't hear it yet.
Let's connect to this. Let's connect to this speaker.
Okay. Is it this the Bluetooth or what? Okay, yeah, that's the Bluetooth speaker.
Maybe I can
Not
hold on.
You should speak.
Can we speak now? You're still muted here.
You are muted. Okay.
He said, can we bring can I see the message? No, that's the only person next. He said, can we bring the speaker to the It's not even fucking up. This would have been hearing it must be. It's like it's connected. So I've connected it to the maybe I should join the Zoom.
All right, so we will have the NMP again later. Sorry for that. We just couldn't hear anything. I think the leader will help us sort that out. Okay. So again, we want to look at the item titled modeling for impact, bridging the gap between research policy and practice. And MC will be taking care of that. Mr. Simon?
Yeah.
Are you on taking?
Yeah.
That's okay. Thank you so much. So we'll be looking at modeling for impact, bridging the gap between research, policy, and practice. So let's have Mr. Simon to take us through that. Are you ready, sir?
Yeah, I'm
Okay.
ready.
It's possible. Ah, flash, flash, flash.
And that will be projected. Once the information is projected.
Sorry, we are trying to take care of our online participants so that they can also be part of what we are doing. And so we have to harmonize some things here. Just a minute, please.
Sure. The user is disabled.
Space disabled.
Let me send you WhatsApp. Yeah. Let me send it to A.
Okay.
Your name.
What me decide on the system? Let me use.
I seem to talk to yeah, like I'm truly I'm able to watch it. So we'll be in charge of the laptop. Should you want from top? Did you bring later presentation?
Did you do? No, received the mail.
Excellent.
That's not it. It's a sensor.
Sent. Check things. It's not. Baby drops. Is there the next one? No, it's not six. Yes, the next one is up. Yeah, but maybe that is right. That's good.
We also send this presentation so that people online can also follow.
Yeah, this one is there, is there.
Okay. That's what he sent himself. Okay, I've seen it. Presentation. We are projecting from the system.
If you move as a system project.
Okay, let's project from it. But
Okay, sorry for the delays. I'll be taking you through the presentation modeling for impact, translating research into policy and practice. So we'll read the outline. Next slide, please. Introduction. The fight against malaria requires research and data-driven insights for informing policy decisions and optimizing intervention strategies. Malaria mathematical modeling has emerged as a powerful tool, enabling us to stimulate complex systems, predict outcomes, and evaluate interventions. However, the journey from research to impact is often faced with challenges, and the translation of research findings into actionable policy and practice remains a significant challenge. So this presentation seeks to explore how modeling can be leveraged to translate research into impact, shaping policy and practice to combat malaria effectively. So malaria remains a significant public health challenge globally. Nigeria bears a substantial burden of malaria cases and deaths. Effective elimination strategies require evidence-based decisions making. So mathematical modeling has become increasingly important in malaria research, enabling policy makers and researchers to simulate intervention scenarios, evaluate potential impact, and optimize strategies. So modeling analyze data to inform policy decisions and resource allocations, predict transmission dynamics, identify high-risk areas, trends. So by bridging the gap between research, policy, and practice, modeling will accelerate the translation of research findings into real-world impact, ultimately contributing to more informed decision-making and better outcomes for individuals, communities, and the society in general. So why modeling? Why do we model? Mathematical modeling involves creating a simplified representation of a complex system or process using mathematical or statistical technique. So in the context of malaria, modeling simulates transmission dynamics, intervention impact, and future trends. So when we modeling basically seeks to answer certain complex problems and make predictions so that when optimized, when translated into policy and practice, these interventions will be optimized for greater impact. So research, policy, and practice. We are trying to find the relationship between research and how it translates into policy and practice. So research basically is a systematic investigation and study of subjects using various methods and techniques to collect and analyze data. The primary goal of research is to generate new knowledge, test hypotheses, and answer questions. So the basic and primary goal of research is to generate new knowledge, test hypotheses, and answer questions. So policy is a set of principles, guidelines, and rules that govern the behavior of individuals, organizations, and governments, often developed to address specific issues or problems. So why research seeks to generate new knowledge, test hypotheses, and answer questions? The findings and outcome of this research is usually translated into a policy that guides or governs the behavior of individuals. So the practice is the application of knowledge, skill, and technique in real-time situations So this involves the implementation of policies, programs, and interventions to address specific problems or issues. And when these policies are in place, it is the responsibility of individuals to apply some of these rules, guidelines, so that we'll be able to address specific problems that are confronting us. But there seems to be a problem between the research policy and practice. There's a disparity between research policy and practice because not all researches or research findings have been translated into actionable policies. And not all policies that are in place are actually being applied or applied according to guidelines. So research policy and practice divide is the gap between the production of research findings and its translation into policy and practice. This is significant. This is a significant challenge that affects many fields, including the healthcare sector. These divides are largely characterized by lack of communication and collaboration between researchers, policymakers, and practitioners. The complexity of research findings makes it challenging to translate them into policy and strategy recommendations. Limited availability of resources and capacity is also responsible for the research policy and practice divide. Different priorities agenda among researchers, policymakers, and practitioners also create the tension and conflict between the researchers and policy makers. We also have cultural and social factors, such as values and beliefs, which also influence how research findings are perceived and used by policymakers and practitioners. So a lot of factors contribute into the research policy practice divide, which ranges from communication, lack of communication, limited availability of resources and capacity, complexity of research findings, different priorities and agendas, and cultural and social factors. So gaps in translating research into policy and practice. When there's a gap between research, policy, and practice, we usually encounter ineffective policy and practice intervention. Without evidence-based solutions, policymakers may implement interventions that are ineffective. Wasted resources, lack of translation of research into policy may lead to poor allocation of resources, time, money, and personnel. So you see, we'll be carrying out a lot of interventions, but no impact. And huge resources will be expended without any value. We will also have poor outcomes. Lack of translation of research can lead to poor outcomes. Policy may lead to poor outcomes for individuals, communities, and society. So when we don't implement evidence-based interventions, we usually encounter poor outcomes and limited impact. Next slide. So the WAMCAT project is a West African Mathematical Modeling Capacity Development Project. This project is being funded by the Icammda Gates Foundation through the University of Ghana. Key partners on this project are the Malaria Consortium, the International Center for Applied Mathematical Modeling and Data Analytics at the Federal University of Oye in Ekiti, and the National Malaria Elimination Program. And this project is being implemented in 5 West African countries: Ghana, Guinea, Guinea-Bissau, Senegal, Nigeria. So how is the WAMCAT project? Next slide. How is the WAMCAT project bridging the research policy and practice divide? The OneCard project is strengthening existing research centers. That is why Malaria Consortium is working with the International Center for Applied Mathematical Modeling and Data Analytics, where we are collaborating to build a pool of malaria mathematical modelers within the West Africa region and Nigeria to develop capacity and deliver high-quality infectious disease modeling. OneCard project has also developed mathematical modeling curriculum to support and serve as an operational framework and guideline on malaria mathematical modeling. We are also operationalizing malaria modeling through the support and secondment of PhD-trained mathematical modelers to the National Malaria Elimination Program to work with program data and prioritized research needs. So the National Malaria Elimination Program has a National Malaria Operational Research Agenda, which has a list of identified, prioritized operational research questions. And whatever the researchers and the modelers are doing is guided by that National Malaria Operational Research Agenda. So the modelers and researchers are helping to answer some of these prioritized operational research questions. We're also building understanding in national programs where we support the interface between the modelers and the National Malaria Elimination Program through monthly interactions with the Surveillance, Monitoring, Evaluation, and Operational Research branch of the National Malaria Elimination Program. We also seek to connect our modelers in the participation of in support participation of modelers to regional and global malaria platforms such as the RBM and SMEC, SP, and DQ subcommittee meetings. So that whatever effort we are doing in country, in Nigeria, we also try as much as possible to interact with our neighboring partners to share experience and also learn best practices on how we can effectively strengthen the fight and eliminate malaria within Nigeria, the region. We are also generating interest because modeling has come as an innovative approach towards malaria elimination, and not a lot of persons, especially among the public health practitioners, are aware of this effort. So by way of generating interest, we want to get as much as many public health professionals to but we also coordinate the awareness workshops, such as this is one of the practical examples of what we are doing to generate interest in modeling, bring public health professionals together to learn how we can get basic skills on modeling and contribute our little portion towards the fight against malaria. Next slide. So approaches that facilitate research policy and practice. We need stakeholders engagement. Of course, we are implementing this project as researchers. You need the policymakers. You also need the practitioners. So there's always the stakeholders engagement so that the effective stakeholders engagement in the research process to ensure that research is relevant. This guides us in such a way that we don't go out of the scope in carrying out and embarking on research that will not be useful or will not be relevant to the program. We also, one other major approach, which is very, very key to bridging the gap between research policy and practice is capacity building of policymakers to use research evidence in their decision makers. We are aware that a lot of research findings and research recommendations have been made, but there's always a miscommunication between the policymakers. They sometimes don't even know the findings of this research and how to translate them into evidence and decision making. So communication and dissemination is very, very key. When as researchers and modelers, it's also very, very important that we communicate and we disseminate our research findings to the right stakeholders so that policymakers will be able to be aware of some of these findings and translate them into actionable decision making. So key enablers of research to policy and practice. The timeliness of our research is also very, very key to research findings being translated into policy and practice. Effective communication is also very important. Accessibility of our research findings is also very important because more oftentimes researchers spend huge resources and time in carrying out research. And at the end of the day, their research findings are not really accessible within policymakers and policy practitioners. The quality of research is also very, very important, as well as relevance and partnership. There's every need for researchers to partner with policymakers and practitioners to close the policy and practice gap. So collaborations and partnerships are also very, very important. Clear communications, mutual respect among partners, shared goals and objectives. When you have researchers, policymakers, and practitioners have shared goals, you see that research findings are easily translated into policy decisions. And flexibility and adaptability of critical is also critical for responding to changing policy and practice. So research is very, very important for us. Those common examples of research policy and practice is whatever interventions we carry out are based on research findings and recommendations. Just like the 2012 WHO recommendation of SMC in sub-Saharan African countries. The role of research showed the effectiveness of SMC in reducing malaria-related illnesses and deaths in high-burden seasonal malaria transmissions. So that research effort was translated into Nigeria's adoption of SMC as a strategy to reduce malaria in children under 5 years in 2024. So the impact is a reduction of the burden of malaria in children under 5 years across 21 states of its implementation in Nigeria. So this is just a typical example of effective collaboration between research, policymakers, and policy practitioners. So the future directions, we hope that will promote locally led research by strengthening local capacity and ownership of modeling initiatives. We also hope to see how multi-disease modeling can explore synergies and trade-offs between malaria and other diseases. Policy-relevant modeling can also improve communication, collaboration between researchers, policymakers, and practitioners to ensure that modeling research is relevant and useful. Developing new modeling techniques and methods to improve the accuracy and reliability of modeling research and integration of modeling surveillance by enhancing real-time data analysis and improved decision-making outcomes. Next slide. So in conclusion, modeling plays a key role in translating research into policy and practice. It provides a framework to assess potential outcomes and inform decision-making. Challenges persist, including the complexity of research to policy relations. To enhance translation strategies such as collaboration between researchers and policymakers, utilizing new modeling techniques and prioritizing clear communication of findings. A clear understanding of these dynamics can lead to more effective policies that are responsive to real-world complexities, informed by evidence. Thank you all.
Yeah. That's a great one from Mr. Simon, and
I won't believe that we have picked one or two things there. We are going to engage really now because, you know, what Mr. Simon touched on is very important for us. Like I said the other time, this room, you know, we have a mix of professionals, people in the academics, people in public health, you know, seated here. While you were introducing ourselves, people said we have mathematicians, we have data scientists, we have, you know, all kinds. And, you know, he has touched on a lot of things, which sometimes makes whatever research we are doing as researchers not to fly or not to become policy, something that can lead to policy, you know, in the country. I'm happy that he has also shown us an example of a research, a translational research that leads to policy in the country. And I want us to know that, because some of us think Nigeria, oh, they don't do anything based on research. It's not true, because actually there are sectors that are waiting to have our results. But the challenge may be that maybe we are not producing what they want. So it's good time for us to discuss now that Mr. Simon has opened this kind of thing up for us now. So we have people who are in the public health here. We have people who are in the academics here. How I wish that we are also program people here. But Nmep is not, I'm not sure if they are available online. If that would be good too, for us to have this kind of discussion. So I want us to raise our questions now based on the things that he has discussed. I don't know if you followed that presentation. You know that he loaded one. Please can we appreciate Mr. Simon for that presentation? So let's have our contributions, our questions, our inputs from all of us. You know, I've told us that we are going to engage and we are going to make this time count. People online too, in case you have questions, you can signify raising your hand for any of the presenters. Okay, so can we have us raise questions based on what Mr. Simon has discussed? So the floor is open to us. All right, anyone? Anyone? Okay, so I'll give us number. Just let's put the hands up once and for all, and then all right, thank you. So I will start from here. Thank you, sir. Number 1, number 2, number 3, and then number 4. So please, media, help check in case we have questions online. Thank you so much. All right, over to you. Oh, number 1.
Thank you very much. Thank you for the presentation. Just curiosity, out of curiosity too, because interest in modeling now, it's one of those things to me as a public health professional. So apart from SMC, is there any other intervention or perhaps some of the other policy that's modeling as needed a positive result? Or is there anything in the pipeline now regarding maybe malaria or any other just a concern or just being curious about what modeling is bringing out right now in transforming or addressing issues that has to do with public health. Thank you.
Thank you so much. So, Mr. Simon, we like to take the questions one by one, and I would also want to say that we have our bosses around, seated also. They can make their contributions to some of these questions. So, Dr. Rossi, I guess you want to respond to any of the questions.
Thank you very much. Modeling has actually done a lot. Most of these interventions you see as a result of modeling, research findings, or research recommendations. Interventions don't just come or are not just implemented. Interventions seek to solve a particular problem. And research and modeling has actually created a lot of scenarios, like the implementation of the ITN, the lava source management, the IRS, and how modeling is also predicting how we can mix some of these interventions for maximum impact, not just a particular intervention, but how when we mix intervention A and intervention B, we'll be able to get the maximum impact. So a lot of work has actually been done by modeling. Thank you very much.
All right, thank you. Mark, would you like to say anything?
All right.
Thanks in addition to what we said, so when Nigeria was going to develop the last strategy that just ended, it got to a point where they needed to predict how much impact they would be making by investing some amount of resources in some particular interventions. And so modeling came to play in that aspect. So in deciding or suggesting the mix of interventions that you will implement in a particular geographical area that will give you a level of impact. And then when you determine that, then you now also want to know how much it will we spend in order to be able to do that. And that helped in prioritizing some mix of interventions, and then help also to determine targets that the strategic plan was supposed to have based on available resources. So it's been useful in malaria stratification, developing the malaria risk map. It also has been useful in this new intervention, perennial malaria chemo prevention, was born out of that malaria stratification. And for that, modeling has also helped to determine which area would you be implementing PMC as opposed to SMC. SMC is targeted at areas where you have seasonal malaria transmission, but PMC is recommended in areas with perennial transmission. So it was modeling that also helped to delineate those geographical areas in the country for PMC and for SMC. So a lot has been done using those modeling.
Thank you. My name is Tirubeni Hayadauda. I think in modeling, you need data to model, and being a field worker, I am very much familiar with how enumerators, liaise with the stakeholders at the local government or what level to manipulate data. How are you able, or what are you doing to ensure that you have accurate data in order not to get spurious policies? Thank you.
Any other question?
Is it the one you put on the sponsor?
Okay.
Yeah, thank you, sir. My question is more on the communication of research findings. So I want to ask more about how possible can it be that there will be kind of more platforms to communicate research findings where there's a kind of consistent meetings between policymakers and also researchers, such that as researchers are working B2B on things that are pertinent to what policymakers need. So there can be this interaction where researchers are working, they know that they are addressing issues that are really needed, both on contention on the side of the policymakers. Thank you.
So during the presentation, I made mention of collaboration. And it's very, very important, even before you carry out, you embark on your research. It's always good to carry along the policy methods so that within the process, as you move on, you are always communicating the process. Joint partnership, and these findings can also be published in publications, journals, newsletters, where policymakers can also have access. Thank you.
Yeah, so yeah, apart from our research findings and all that, after you have published your work, another way is having to meet, just like our monthly meeting with SMEO. So we communicate some of the things we have found. And apart from that, there are social media platforms so that you can easily disseminate your information, what you have gotten from it. From there, people can contact you. I've seen some people contacted me on certain things because I put something online. So it's another platform where you can communicate, and from there you can start discussion. Thank you.
Thank you very much, bro.
Well, thank you so much. Sorry, I didn't get to the house. Very important. I was being for the questions.
But sure.
Online. Okay. So online we have Rema, Augustine. Are you there? You can unmute and ask your question. Augustine, are you there? Augustine, please unmute yourself and ask your question if you are there. Is it only Augustine?
Yes. She's still muted.
So please unmute yourself.
She's still muted.
Are we the one that muted?
Okay, yeah, I can hear now. I was unable to unmute. I think the host did not give me the permission to unmute. All right, good morning, everyone, and thanks for the discussion so far. I have two questions. The first question is, I appreciate the divide between research, policy, and practice. And I know that along this continuum, a lot needs to be done to be strengthened. I just want to focus on the policy practice section of this continuum. So we have lots of policies, especially in the malaria space. And I'll just give a simple example. We have reviewed our guidelines most recently in 2020. LLINs is one of the easiest to use tool to control malaria. Unfortunately, we see that when it comes to practice, there are other factors that come into play. So we have gotten evidence from research. We have translated that into policies. But between the policy and the practice, we now start having a lot of factors that makes the practice of those very beautiful policies not to be well implemented, hence affecting the impact. So my question is there a role for modeling in influencing practice? And what can be done better to translate policies into practice? Then my second question, I think when Dr. Oresonyo spoke, she talked about how mathematical modeling was useful in the development of the just concluded strategic plan. And I know in that plan, I saw lots of modeling when they try to do business as usual, business unusual. If you do this mix in implement and do a mix of this implementation, see what the expected outcome or impact is likely to be. So my question is, having completed the 2021-2025 strategic plan, looking back, would we say that the predictions from those modelings were accurate or near accurate? I guess what I'm asking in another way is, what is the reliability of the model of the models? Thanks, and over.
All right, thank you so much, Justin, for the question. So, would you want to respond to the question?
Okay, thank you very much. Like I said the other time that now, in terms of determining the optimal interventions, modeling can actually advise and give directions to, especially because you know that different locations has their own behavior in terms of the transmissions. The transmission of malaria in Abuja is not the same as any other state in Nigeria because there are a lot of heterogeneities that exist, internal heterogeneities that exist that affect whatsoever go on as far as malaria is concerned. We talk about climate, we talk about socio-cultural issues, socio-economic, a lot of things are involved in that kind of model because it's more of policy-driven model. You know? So if it's a policy-driven model, it has to factor a lot of things inside. Then, apart from that, in that you are coming up with a model that is predicting maybe the use of LLRN, and then in doing that, you also have to consider the aspect of cost-effective analysis because that a model is predicting that LLRN is the best in this particular location may not necessarily mean that it's going to be the most cost-effective. So you have to also put that one in place. That's health economic aspect. So if that is not put in place, you are not because the policymaker wants to know how much will I put here that will take care of these of the population in terms of how much will I put on LLIN, how much will I put on these. At the end of the day, they are looking for the optimal cost. So in doing that, your modeling should be able to predict that. But the prediction must not be fixed. It must be an interval prediction because, like, take for instance, you are coming from Lagos to Abuja now. Now, nobody tells you that exactly. Even the pilot does not tell you exactly you are going to get here by. Maybe you left Lagos by 10, and then normally it's 1 hour 15 minutes. So there is always an interval estimate that is being given. That okay, maybe plus or minus. Now, if you don't give interval estimates, there is always some level of probability that goes on within some of these predictions. So if given the interval estimates makes at the end of the day, the prediction may fall in within that particular interval estimate that is being given. So I think that is what we are trying to say on the issue of using modeling to predict the optimal strategy as the case may be. And then the other question was talking about
I think the first one that you addressed now about the reliability of the model, right?
Yes. So yes.
Like which you talked about the issue of fact that okay. So I guess now it's now interested in now that NMSP is over, that now we test if really what the model predicted is what really happened.
Yes.
Okay. Is the model reliable really? But you talked about interval estimate.
Yes.
Yes. The uncertainty.
Yes. So because when you talk about prediction, they are always affected by some uncertainties and variability. So you have to put an interval estimate, not necessarily a fixed estimate. Thank you.
All right, thank you so much, Prof. Just to add to that, I think one of the, when I went to see some of the people that, about the MSP work, I was asking them, why do you need to wait for 5 years to ensure that the model has predicted what you know? So, because if they do some of these things that ain't covered, so you begin to feed in the data you got. If you feed the data you got into your model to see if the model is actually predicting what you mapped out from the work. So that will tell. So in 1 year, 2 years, the model will predicting something very nice. So you'll be seeing the results as it's going. You don't need to wait for 5 years before you want to see whether the model is predicting what you know. So they just happen. Thank you.
Okay, thank you so much. The first question asked was, what can be done better? As far as your practice is concerned, that there are models built, research, policy, and then practice. People have done research, and then policy have been made for practice now. And you cited the example of LLIN usage. The LLIN has been found to be very good and easy to use, but that in practice, we don't get to achieve that. Can modeling come in also to enhance or better what we experience as far as practice is concerned? So we bring in modeling to also address that aspect, the aspect of practice. I think it's the first question we asked before asking the other one, if the model, okay. So I don't see want to answer. Okay, then.
All right, thank you. I think there are huge opportunities for using modeling to improve practice. So I give an example. When I was speaking earlier, I talked about perennial malaria chemo prevention, which is it's not particularly new, but it's just been renamed by WHO, and it used to be intermittent preventive treatment of malaria in infants, but now it's perennial malaria chemo prevention, and it's been recommended since 2010 by WHO, but none of the African countries took it on as an intervention for malaria control, except Sierra Leone. So Sierra Leone was the only one that implemented that intervention, but then it's an effective intervention. So WHO had to revisit it to say, okay, what are the issues with this intervention? Why are why are countries not adopting it as a malaria intervention that they should be deploying in their countries? And they found 1 or 2 questions that were issues. And then they revised the malaria guideline with regards to that intervention. They removed some of the bottlenecks. For instance, SP resistance profiling, the initial guidelines, and you must do that before you can implement this intervention. And they said there were so many things that restricted countries. So this new guideline now opened it up and made it a little bit more flexible for countries to take a decision about how they want to implement that intervention. Now, that flexibility that they introduced, because initially that intervention was recommended for children in infancy, 0 to 12 months, and it was recommended to be given 3 times at 10 weeks, 14 weeks, and 9 months, and that's it. And it was supposed to be given along with EPI. So those EPI schedules that align with those 3 doses. But in the new recommendation, they removed the restriction on the number of doses. They also removed the restriction on the age that can take it. Now, making it a country-level decision. So they now said countries should use their data to determine the age and the dose that intervention will be given. So again, if you adopt it as a policy, you still have to cross that hurdle. And the question is, what can be used to do this? And this is again where modeling comes into play. So it answers the question about a policy existing, and then it's difficult to practice that policy because you don't know what to do. Because I mean, how many doses will you give, for instance, that will give you the maximum impact? And in what age group will you have that maximum impact? So Malaria Consortium has been using, modeling because we are currently doing an implementation research, and implementation research is also a tool that you use to bridge the gap between policy and practice. You have an intervention that is effective, but you don't know how to implement it optimally to give you the highest impact. So you use an implementation research to collect data, and then you feed that data into a model to help you to, predict, for instance, if we give 5 doses, what will be the impact or the effect of that 5 doses on malaria incidence in these children? And then if we increase the age from infancy to 24 months, for instance, do you prolong the longevity of your impact or your effect? Or how many doses can you? So these are the questions that malaria modeling can help to answer, and that we are also trying to use to answer those questions. We've started collecting data in Osun State, for instance. We are running an implementation research on PMC in Osun State, 6 local governments. It's been 18 months now that children have been receiving PMC, and we've gotten some preliminary data from that we are now putting into a model to see what is the impact of, some children receive 5 doses, some receive 6, some receive 10. So to now see what is the impact of the number of doses you received on, malaria incidence in those children and in those categories of age groups. So just to cite an example.
Thank you so much. I think that has really done with justice to the question. I said, I don't know if Augustine, I don't know if you are satisfied with that. Okay.
Still was typed.
Okay, we still have something to say. All right, thank you so much, everyone, for participating. So we are going to be moving to the next thing on our agenda, and the next thing on take tea. If you don't like to take tea, please take the break. If I won't be tea, but I would like you to take the tea and they go together. All right, so let's walk around, interact with each other. If you see somebody you don't know before, you are meeting somebody for the first time, so it also gives you room to interact. So let's have a tea break now, and the tea break is going to be lasting for 30 minutes. So what's time now? Let's have to check time. So this is 11:54. So after 30 minutes, we'll be returning. All right, thank you so much. Let's have our tea break. Let's have our tea break. Please, let's go for our tea break.
Hello, sir. Hello, sir. Yes, sir. Baba, you see this. Okay, I'll put it in my book. Yes, you can go for the thing.
All right, let's for once leave our laptops. Let's write, let's walk around. I think probably to tell us something that you see for how many hours here is equivalent to you taking some numbers of cigarettes. So can you write and then try to stretch out the flexibility equivalent to let's write and move around. Great. Take your deep breath. Thank you. Thank you. mathematical modeling and public health analytics. A quick one for us before we go on to the next thing. In case you want to use the Wi-Fi, this media, can you display for us again the password and the name of the Wi-Fi? So you have Grandvilla Networks. And so that's the password there, Grandvilla at 25 Ultra. So, okay. And then for our online participants, please would like to say that there will be an attendance for us. So a Google link will be sent to us for everyone to fill the attendance so that it will help us to prepare the certificates. For people attending physically, we'll have our attendance taken at the end of the day. And that will do for each day. So at the end of each day, so you have to sit at the attendance, and that so that we prepare our certificate for us. All right, so next on the agenda for us, I don't know if NMEP, we have been able to reach out to the NMEP. Yeah. My box. Okay. So we will be having the first training for the day, and that's going to be taken by our amiable professor, who will be opening the ground for us, because you know when you want to do technical session like this, it's important that the foundation is well laid, so that every other thing that will be built on it, will take a proper shape. And that's why we'll be bringing up Prof to lay for us certain foundation that the rest of us who may be training on one thing or the other will be building on. And so we're looking at introduction to infectious disease modeling, overview of infectious disease modeling. Will be taken by dear Prof, Professor Emmanuel Hafolabi Bakari. Please join me to welcome Prof on board, and we take us through the working out with yourself.
Good afternoon.
Yes, yeah, concern.
It's good afternoon, everyone. I was able to get this 2 days Symposium on malaria modeling. Actually, malaria is an infectious disease, and so it's of great interest to us and the country at large. And then while trying to model malaria, we are also interested in other infectious diseases like vaccine preventive diseases and the NTBs and others. So giving a kind of foundation and overlay of infectious disease modeling and malaria modeling, as the case may be. Okay, next. Now, there was this man called William Ross. He was the first person to be able to develop a malaria model. He was a medical doctor. He was not a mathematician. He has a very strong using mathematics to explore what is going on in malaria dynamics. So he went on and developed. Now all the models you see in malaria is started with that. And what how did they come to that? They came to that like from that all epidemiology, as the case may be, from time to time, from place to place, you must be considered mathematical. They must be considered mathematicians. However, many villages are implicated and is to be considered scientifically at all. Now, to
say that a disease depends upon certain factor is not to say much. That's one thing in epidemiology is that okay, what are the factors of this particular disease? Find the factors, carry out the statistical analysis, lots of that correlation, regression, and all of that. That's the hence it explains the concept of mathematical modeling, which has to that one has to be the more functional approach. Functional approach. You don't look at the underlying, you are seeing incidents, but you don't, there's something producing that incident. The underlying thing, the underlying thing. So it's like it's given to the base. You understand? And even all this machine learning and all of that, they are black box model. You cannot use them to see the non-linear nature in disease transmission. So there are non-linear processes in disease transmission that black box models, machine learning, statistics cannot explore, which many people who are doing epidemiologists, interest is basically on okay, disease depends on certain factors like or cancer of the lung, like smoking and all of that. And then you are trying to correlate, showing association between smoking and then you collect data and then you are plotting. Those are very, 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 very hard. Now we came up as a ultimate goal. We can also form an estimate as to how large each of these factors that we have mentioned influence the whole result. And the mathematical method of treatment is really nothing but the application of careful listening to the problem at issue. And so what brought us about the careful listening, about thinking out of the box, is the issue of bringing in the aspect of mathematical model, which is mechanistic approach. Next slide. So now, what is the motivation? Now, we have seen that math modeling plays an important role in ordering our thoughts and shaping our vague intuitive notions. Now, if you find out that something is going on in the environment, if, for instance, somebody was talking the other day about cognitive decline. People are having cognitive decline these days. Somebody is dementia, right? So, and then I want to capture that mathematically. So, and that's what brings about mathematical modeling. Being able to represent what is going on in the real world with mathematical language. That's mathematical modeling. Now, I'm seeing what's going on in the real world. And then, what can I use to capture that cognitive decline? So, I have an exponential model. I can develop an exponential model that captures the dynamics at which that thing is going that thing, or whether it's going of exponential decrease or exponential growth. So, and then initial models are verbal descriptions. You can't hear me. Okay. Can you hear me now? Online participant.
Yes, sir.
Okay. So now initial models are verbal descriptions that tend to become insufficient as soon as the scenarios become complicated. Like most times, I mean, in those in the medieval, you find out that people are developing models. And then the kind of models that are just verbal descriptions, verbal descriptions of that tends to become not being able to capture the essence, the whole essence of what is going on in the real world. Now, because mathematical modeling itself is just an approximate. It's an approximate. The real world is very complex. It's complex. And then you are finding an approximate way to capture what is going on in the real world. And then in doing that, so many in trying to do that, you are thinking, like a few days ago, I was just on the bed and I was thinking about, okay, was it on Sunday? I think on Monday. Okay, I was model corruption in Nigeria. Yes, so I putting up something like that, the modeling of corruption in Nigeria. And then I have to think in different parts. Okay, we have the society of people who are bothering, and then we have people already exposed to or infections, integrated people who are already, and then people who are already infected with corruption. Yes, infectious, and then people who are like that, who are asymptomatic, like they are not showing symptoms of corruption. Yes, because they are not seeing money. They are potential corrupt guys. So I think the next time you are a diagnostic tool to be able to test people. You understand? And those ones are very dangerous in operation, they will get an elimination of corruption very, very difficult. So then now there are two ways to recover. Now you can recover one by rehabilitation, and two, we kill you. But that's one of the options in China. You die. Yes. It's either you die or we rehabilitate you. Rehabilitation may go into you have to be in prison all your life. Yes, and be schooling there, enjoy your life and all of that. But you don't come back to the community because we are not sure whether you are still going to be the same person we want in the society. Okay? I think this model is already going on conceptually. Thank you. Next one. Now, over the years, you have encountered very interesting, inspiring, and challenging discussion at the end of workshops. Infection disease and a lot of stuff have come up. Like when a disease just starts now, when it just like COVID, you have never had SARS-CoV-2. You have had SARS-CoV-1, but SARS-CoV-2, that was the first time. And then it became very difficult for us to we need to understand the biology. You understand? The biology needs to be, understood. It has to come clear to us. So, and then little by little, because like your model is as good as your biology. If your biology is bad, your model will be bad. If you don't understand the dynamics of transmission of a particular disease, then your model will be questionable. So then you see, when a disease just starts, just like what we are looking at, while most disease transmission will predict an unexpected exponential growth. Now, when the disease starts, the first thing you see is that you see an exponential growth. The disease will be growing. As it's growing, you cannot declare an epidemic from studies. For example, the case has reached up to 5 and above. So once 5 and above, you declare an epidemic, and then it is growing. And that's the period you can calculate your adult. You can't establish adults when the control has already been achieved. It's not possible. So this is growing, and then we find out that why was the transmission predict an expected exponential growth at the beginning of the epidemic? Empirical data often exhibit sub-exponential growth patterns. How do we best characterize these non-unique sub-exponential rate functions in the context of infectious disease modeling? So when you are having, like something growing, and then it's adding up from 1 to 20, 30, 40, 50, 60, 70. The question is, when is it going to come down? When are we going to see the disease coming down? Now, before we can do that, there are so many things that have to be put in place. And that was when, since you don't understand the disease for COVID, everybody has to go home. They have to sit at home, and then they start quarantining, isolation, all those non-pharmaceutical intervention, because for COVID, it was just a new disease. And people cannot really get to understand the dynamics of COVID-19. It was later we started seeing different kinds of strains, variants, and from Omicron to different kind of Omicron, and different kind of strains because the viral disease. Next, please. So, are there many or even infinitely many mechanisms that lead to the same or very similar sub-exponential growth function? These are questions to ruminating about. And then does a slower than expected initial growth at the beginning of the epidemic imply a smaller value of the reproduction numbers? Now, when an exponential growth is slow, like the way the disease is growing, if it's slow, does it mean that the reproduction number will be slow? This is there's some uncertainty around that. Because most, when disease starts, it's always, they tend to more fluctuation, stochastic fluctuation. Now, because there are little number of people that are already infected with the disease. So you find out that a lot of uncertainty are there. You cannot really say, you cannot capture that kind of model with deterministic model when it has not started. So it has to be stochastic. So, and then a key, so R naught is a key quantity. I know many of us should have heard about R naught before in the field of infectious disease model. Next. So the question again is that what exactly does it mean when we say deterministic models approximate their stochastic counterpart by the law of large number? So it means that when the population is growing very large, just like malaria now, malaria now you cannot use stochastic model because of the law of large number. You need a deterministic model. A lot of people are infected with malaria. In Nigeria, we have a lot of data and all of that. So a deterministic model will be able to capture that because as the number of population of people infected is growing, so we have what is called a deterministic model, which becomes an approximate of the stochastic counterpart. So are we referring to a population that's infinitely large or something else? So, and then which features of the population-based model in which exponential distribution is assumed at the individual levels can be generalized with non-exponential distribution? Now, take for instance now, we have the transmission coefficient. Now, when there is going to be a disease, there will be a contact between the infected person and the susceptible person. And then that contact is measured at a particular rate, which is called the transmission rate. So the transmission rate is follows, most times in our model, we usually assume that it follows an exponential growth. But in the real life, it doesn't follow an exponential distribution. It could follow, maybe depending on the situation, it could follow. So that was why we are saying that a non-exponential distribution. I mean, it could follow a Poisson distribution, it could follow a gamma distribution, it could follow technical distribution. So now the situation that when it follows that, then it's bringing us to another thing, which is different from the normal thing model in most of our particular model. Next. So regarding the effectiveness of control measure against the spread of disease, even if imperfect implementation in terms of coverage or compliance has been taken into account in models, empirical observation often leads us to the impression that the control measure that looks good in theory will not work at all in practice. Are there more theories that will capture this phenomenon? You know that's very true. And you are just like what we are saying the other time. You develop a model again that about 50% cases to be affected from the model. But when you go and test it in the real life, you find out that this is not really the same thing, which was what I was talking about the other time, that a lot of uncertainties in prediction we can mitigate that when we go for interval estimates in our prediction. When you don't go for fixed estimates, now you are saying that 50, but if I say between 50 and 100, it could fall within. But if you say 50 exactly, and then you got 30, so your prediction is wrong. So and that was why so most times now when and it's some confidence interval or some predictive interval, either you are using frequency approach or variation approach. So if the variation approach, the predictive interval is correct, and then the frequency approach, you say the confidence interval. So how do we reconcile the quantity that we clear by transmission models? Observe better. We observe data from outbreak investigation and public health surveillance. So, for you to do that, you need many data. Not just pick incident data. There are certain parameters that because what is going on there is not represented by the incident data. Take for instance the infectious period. The infectious period cannot be captured or cannot be estimated by the incident data because it's biological, it's a clinical thing. So it's either you are looking through the existing literatures because the incident data is only captured people who came to the report. It's different from infectious period. So these are things that modelers need to get clear that you cannot estimate the infectious period from incidence data because they are biological and they form a biological mechanism. So the need for precise definition of average distribution in quantitative analysis. Next. Now, what do we mean by a case? When data from outbreak investigation and surveillance are presented as time series of number of cases. So what do you mean by, I think some of us are epidemiologists, so can we start talking? What do you mean by a case? Yes. Who's going to help me? A case. What do you mean by a case? And then we now have number of cases. Yes. It's okay. 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 That there are some disease like some of these vaccines, like that's how now. You don't necessarily need to be showing any special case. But once you are suspected, you will record it first before they now confirm you and all of that. So if you are showing symptoms, it may not, like when you are showing symptoms of a particular disease, it shares, there are some diseases that shares symptoms with others, like Lassa fever shares some symptoms with malaria and all of that. So they have to pick you up and then, but now, and when, this for necessarily for epidemic, like when data from outbreak investigation are presented as time series number of cases. So, and then over time, maybe over a long period of time, which now are the time series plots to look at. And then it gives us a picture, like a picture of what we can see in the data, how the data is behaving and all that. So, can you go down quickly so that I can move? Go down. Okay, so what is mathematical modeling? It is an abstract representation of a system based on mathematical terms in order to study the effects of different components and consequently to make predictions. So we are trying to study the effects of different components and we're bringing them together and then consequently to make predictions. Yes? And then now the development of mathematical modeling depends on several factors such as data at hand, and then the hypothesis to be addressed, and then the experience of the modeler also playing. Now, if you are developing a model, now if your model, we are still going to come there now. Part of what make up a good model is that you have quality data to be able to, to be able to check and to validate the model. Now, once model parameters are fitted, and then you also need the experience also play a lot of role. Experience also play a lot of role in modeling because if you have been working on certain things over the years, there is a way it helps you to build better models, yes, over the years. So once model parameters are fitted with prevented data, mathematical models have the capacity to serve as virtual clinical trials to uncover the success and pitfall of antiviral treatment. During COVID, that was what they used. Now, nobody had there has not been any case before that year, any case of COVID-19 before. So when they wanted to conclude on the issue of pharmaceutical intervention, like in case of social distancing, number of meters that everyone should have between themselves and all of that, it was done by mathematical model. So what I mean, the prediction by mathematical model was what brought about, okay, you have to be so meter between the other person, and then the prediction also come up with, normally if you want to do vaccination, it's only given to it's only given to people who are susceptible. If you are doing vaccination, normally, it's always to target people who have not gotten it. But the prediction says that people who have gotten it and people who have not gotten it should be vaccinated. So everybody was vaccinated at random. So, I mean, if you want, just go collect your vaccine and all of that, because for COVID, that was the prediction. So, but normally for disease, you find out that you vaccinate people who are susceptible in the population, and that vaccination can work for others. So somebody's vaccination can work for you. I mean, so because some people are vaccinated, and then this is also done based on adults, which call the herd immunity. 1 minus 1 over adults. Now, like for malaria now, the outlook for malaria is like 100%. 100, yeah, it's 100. So if you say 1 minus 1 over 100, what will it give you? What will it give you? So it means everybody in Nigeria supposed to be vaccinated. Yeah. Everybody in Nigeria supposed to be vaccinated. So until you do that, we are not yet there. So can you move forward? Yeah, recent years I've seen an increasing trend in the number of publications, both in high-profile journals and more generally that utilize mathematical models. This is associated with an increased understanding of what models can offer in terms of predictions and insights. Now, models can give you light in terms of understanding what is going on. You just want to have an understanding of what is going on. That's what we call descriptive. So maybe I don't even have, as a model, like if I don't have data, I can still model. Yes. I can still model without data. But there's a level it can get to that. I will need data to do what? To validate. Yes. And because disease is about panic. It's about persons, population. It's about space, location. So I'm not speaking to anywhere. That's what the data model. I went to, examine a student somewhere, in COVID statements and 2 students. But they have done good work, but it's not location based, so it's theoretical. Yeah, it's theoretical. So I told them, you can't recommend anybody, you can't give recommendations. So remove all your recommendations. Because this one will not be useful to any location. Because there's no data. Are you getting what I'm saying now? It takes data to form policy. But there's no data, there's no policy. You are 5 in the family or 6 in the family. How do you want to make plan? Say you are 6. You want to buy rice, 2 kg of rice. If you don't know the number of people, you can't make correct plan. In a month, this how many kg that will take care of everybody here? Maybe it's 1 bag. You plan. Good countries plan. This year we don't really plan. Everybody just wake up, do what you like and go. No plan. But when you want to make policies are dependent on data. How can you tell me? I was asking the banker one day, I said, you told me that I should, every day, I can only collect 1,000 naira from the bank. Who told you? All of that lie, I don't know anything. He said, if you could give me your data, I will formulate a model that will predict how much, because this is an heterogeneous setting. We have the poor, then the rich, and then we also have rich who have so many dependents in a day, and there are emergencies. Are you getting us now? You have to factor that before you can get to that. Okay, maybe my ATM will have been tailored to this amount I can collect based on what I have in the bank, or based on my need, or based on so many factors. Then if I use my ATM, it will be that, oh, this is a class that this person. You understand what I'm saying now? You cannot just tell me that everybody must collect 50,000 from the ATM. What informed that policy is wrong. So everybody just wake up one day and make policy without depending on data. So that's what we do everywhere. And that is why all those policies don't work. They fail. When they fail, we pick another one again. So we are saying that any model can be typically thought of as a conceptual tool that explains how an object will behave. So you start, there are two work. You have the conceptual world and the real world. So the conceptual world, there's a feedback actually. So you start every model from the real world. What you are seeing in the real world. Let's say, for instance, I know what is going on with malaria transmission and all of that. I've thought about it and all. And from there, I'm coming back to the conceptual world. The conceptual world is the world of ideas. The world of ideas. I'm thinking about, this is how malaria, from what I've read from malaria biology and all of that. So I understand that. I mean, the mosquito plays a lot of role, the plasmodium falciparum plays a lot of role, and then the human also plays a lot of role. I'm bringing all of this together, developing my knowledge. Now, anything I'm developing, I must be able to relate it back to the real world. Does it represent what I see in the real world? So the conceptual world, there must be a community between the conceptual world and the real world. So if there is no community, then some people, like most of my colleagues who are mathematicians, they just sit down in their office and develop models that are not useful for anybody. Yes. So we develop model, this and that, just puts X and then Y, and then you ask, why do you do so? There's no relationship. So if your model does not represent what you have, like I define, say a mathematical model is a representation in mathematical terms of the real world. The real world now may be infectious disease, the malaria, but I'm using mathematical equations or terms or variables or parameters to explain what is going on there. And then it must align. So now, a mathematical model uses the language of maths to produce more refined and precise description. In epidemiology, model allow us to translate between behavior at various scales. Behavior at various scales. Now, it could be time scales. Time. Like sometimes the scale, we are working on a project with NTD group, and then the data we have does not have time. Because if you collect a data, a cross-sectional data, it does not have time. So the scale may be age. So my scale for that is age and not time. So if the scale is different, what do I do? How do I do that kind of model? Because so that's why you see, if you are going to do modeling very well, you need to understand different types of data. And then what are the kind of mathematics I can use to be able to solve this kind of data. If you don't know, if you don't get it, then you are going to be the trash. So now, or extrapolate from a known set of conditions to another. So now, I want to use my model to predict from here. The model, the data says I have a set of data, time series data from 2010 to 2025. Maybe we are in May 2025, and I want to move from here to 2020. That. Now, most times, if you use a deterministic model, it gives you the same. Yeah, deterministic model prediction, the same, because there's no randomness. So you have the same thing you are seeing here is the same thing you see in the next 30 years. Reason because there's no fluctuation. I know that one has defeated the purpose of the prediction. So we are going to look at that as we move on. Now, as such, models allow us to predict the population level epidemic dynamics from an individual level knowledge of epidemiological factors. The long-term behavior. So one, individual knowledge in terms of who are those in this population that are susceptible, who are those that are infected and infectious, who are those that are on the pre-infectious stage, which we normally represent as the exposed, right? They are the pre-infection or incubating stage. And then who are those in the population that are asymptomatic? Who are those in the population that are okay for malaria? You know, you don't recover. You don't recover. You have what you call pseudo recovery. Huh? Do you understand? Huh? You don't recover. You understand? So now, even if you use ACT, right? You use ACT. Do you know what it does? What will ACT? What's the work of ACT? Let me ask. How many of us are working on malaria here? So what's the work of ACT? Yes, so it's very important. Some of us have been factoring it and good there, but you don't know because if you factor wrong thing there, your model will be bad. You know, the first thing I look is whether your model regulate the biology, the malaria biology. If it doesn't, the work will be cancelled there. I have to go and start all over. Yes. So I'm hearing next. ACT, what's the work of ACT? Anybody? Yes.
It decreases the parasite level.
It decreases the parasite level. Okay. It clears which kind of parasite? We have gametocytes, we have Plasmodium, Merocytes, and all of that. Yes. You know, like the mosquito, the sporocytes, you know. You see, if you don't understand the cycles, even inside the mosquito, many of these things you don't know how ACT tackles it. You have to get that clear. That's okay. Now, in case the mosquito picks from you the gametocyte, right? Right? Yes. So, and then gives you the sporocyte. Yeah. So what we are saying is that, see, now when you are, I mean, there are populations, like I said, asymptomatic, which is like 80% of the population, they are asymptomatic. 80%, yeah, by studies. So now, as you are seated now, I cannot really say that all of us are recovered. You are looking very nice, you are not showing any symptoms, but I cannot say. Do you understand that? So that's why we cover the shape. Because when you are recovered, you can still I mean, yeah. So no, you don't go back. You see now, that's another challenge. When you are recovered, when you say you are that recovered class is dangerous. Do you understand? And because when you say people recover, what they recover from? What do you recover from when you say ACT? What do you recover from? Yeah? From the symptoms, right? Not easy. Do you understand me now? You have to clear it very well. So when you say people go back to the susceptible, how? You mean that once I recover, I go back to vulnerable? I'm now vulnerable. I'm no longer having a life. So that's that part. Yes, for malaria. Go down, please. Now, models come in a variety of forms, from highly complex, like jets, need a range of experts to create and maintain them, to simple toy model like bicycles, which can easily be understood, modified. You know, all these things are models. It's only in Nigeria people don't do anything. Before they will develop any aircraft, they already develop the model for the aircraft and then they run the simulation. In the course of running the simulation, they carry out some text, specificity, and sensitivity, everything about that before, and it has to have a certain percentage before they will run it out. They test many things. They will run the simulation before you can now say, oh, let's be using it from today, it has been launched. So models, simple model like thought, a bicycle, you want to. So the decision whether to travel by bike or by aircraft depends on several factors such as distance, or time, or cost. Now, similarly, which sort of model is the most appropriate depends on the precision or generality required, the availability of data, and the time frame in which results are needed. Now, there are some models that are very, very complex. Like malaria model now is very, very complex. So, if you are asking somebody that's okay for a model that is going to be used for prediction, it's going to be very complex. So you have to factor many things into it. So if you ask somebody to, you are giving the best tools to do that kind of model, you'll be joking. It may be difficult. Because there may be need for many data, available data, quality data. And then time frame also is involved. Now, by definition, all models are wrong in the sense that even the most complex will make some simplifying assumptions. What we mean was not that wrong in the sense is that each model is based on certain assumptions. Are you getting that? So you all assume. So assumptions, the assumptions on the model is the limitation around the model. So that's why when you develop a model and you analyze, you must be able to explain some of the limitations around what you have done. Now, it is therefore difficult to express definitely which model is right. Though naturally we are interested in developing models that capture essential features of the system. So that is a good model. I'm going to talk about that. So can you go down? So ultimately, so modeling. So why do we model? Because we want to plan for outbreaks. We want to plan. So in planning, one of the tools that I use for planning is that you let model see, like, let model help you to see the future. So, and then recently we started thinking that, some vaccine preventive disease in Nigeria. We are working on malaria, but we saw that we want to also speak to some of those things so that we can help the country. So we started venturing to some other data like MPOS. And recently one of our paper has been accepted, that's MPOS, on developing the forecasting and predicting what's going to happen in the next 2 years of MPOS in Nigeria by BXC infectious disease. So it's one, I'll show the paper here before I finish. So you are planning for outbreaks. And then the speed, you want to know the speed of the spread. How is the disease going to spread? Are you getting me now? The speed of the spread. Then you also want to know how severe will this disease be in terms of the reproduction number. When the reproduction number is high or it's very high, it means that let's assume that the reproduction number is 4. Means that at least, one person will infect at least 4 persons. So you know what that means. I don't have a board here. I'll show you the tree. How the thing goes. I'll show you how it goes. One person, if it's 4, then at least one person will infect 4 persons. If it's so, for malaria, at least one person will infect 100 persons. At least. So, intervention effectiveness. You want to know what is the optimal intervention effectiveness. Control intervention effectiveness. That's one of the reasons why we model. Now, what kind of model do I need? Now, it starts from question. It depends on the question you want to ask. Now, every model starts from question. Right? If you are developing a model, you don't have a question, then you don't know where you are going. And the question does not come from math. So, where does the question come from? Right? But only malaria. I'm talking of malaria now. Malaria. And the question is not What is scientific analysis? So that's better though. But all these things I see around, I cancel them. Yes, I cancel them. I've been to many schools in Nigeria, that's what I see everywhere. I cancel them. You have to go and write again. Yes. But that's what God is using us for that. To digitalize all this things we are doing everywhere before. Yeah. I've been to the lesson, but to examine student, PhD student. I've been to many schools around UNN. Same story. So all of these must be corrected. Now, question. The question does not come from maths. It comes from where? Malaria. And that's why when we wanted to start our PhD work, we went through Nimura. I'm sorry, is it Nimura? Yes, Nimura. Research, that's research agenda. All the questions we are answering in the center is from Nimura. There's a paper we just got accepted on the female genital dystonia Nigeria by modeling art system, something. It's explained that journal. The key one on 5.0. The paper was won by one of my master students. Yeah. We got the question from NTV people, not from mathematics. 2 questions. And the lady was able to, we are already on the second part on FGS. And that's the first modeling paper on FGS in Nigeria. The first. With Rabbi Ibrahim, is a major guy in FGS in Nigeria. So, what kind of model do I need? Statistical model, dynamic or mathematical model, health economic model. Which one do I need? These are questions you need to think about. If you want to use statistical model, why should you use statistical model? You don't listen why. Can you move to the next? Are you okay? Okay, mathematical modeling aims at facilitating our understanding of the medical, the biological, the ecological, the social interaction that manifest the outbreaks and epidemics of infectious disease in order to gain insight into specific questions or to generate theories about what must or might happen. Now, when you are developing a mathematical model, take for instance for malaria, like I was talking about, certain heterogeneities, factors that goes on within a particular setting. That also affect the way the disease is spreading in the location. To be medical aspect of malaria. Now that you need to factor in, to be some biological aspects of malaria. Take for instance some of those things we're discussing about now. In view of using ACT, and then what does ACT does, or any other, if it's NLIN, you understand? If you are using NLIN indoor, outdoor, what do you use? You understand? These are things that you have to, like social interactions, ecological issues, like climate. You understand? There are things that also affect disease progression or even malaria. So, are there statistical models aimed at capturing the data generation process? And then for detecting general patterns, predicting epidemic trajectories, managing control strategies, or simply describing epidemic trends. Now, within both mathematical and statistical models, there are models designed at the population level in a phenomenological way versus models that are individual based. Now, there are individual based like what's it called? Image. But what I still don't like, but as a mathematician, I want to feel my model. I want to be able to when people that are doing image, they don't know what is going on inside the model. Right? Some of these individual based model, you can't control, you can't do anything. So people are behind the model. Now, but as a mathematical modeler, I want to be able to see what I'm modeling. For mode, I can't see. It's a black box model. Yeah, it's black box model. So it's whatsoever the person has put inside that will control what we give out. So that's the only challenge I have. But like for when they wanted to make decision on the UK feed amount, I think it was done by my Ferrari and some few other modelers. They used the simplest models. That was what they used to make decision. Simplest statistical models. Even for COVID, there was no need for individual based model. It was the statistical models that was used. So we just need to know which kind of model do I need. Now predicting epidemic trajectories and all of that. Can you move down to the next page, please? Move down. Okay, so the development of many new statistical models and methods in the study of infectious disease were driven by HIV epidemic. So I think after Ronald Ross, after he developed this model, there were some people who also did something on malaria. I think I'm going to show that after some time now. So driven by HIV epidemic and all of that. So data arising from infectious disease investigation pose unique challenges in classic statistical theory and practice because disease outbreak data do not arise from design experiments. You cannot repeat COVID by experiment. They are natural phenomena when it comes to outbreak. So that data you can't collect it by RNG, right? It's natural. So when it comes to disease outbreak, they are not something that you can arrange by experiment. You need to set up something like that. No. So now each outbreak cannot be repeated naturally under identical conditions. Whereas the large amount and multiple sources of clinical data, outbreak investigation data from non-conventional surveys, public health surveillance, and observational data from prevalence and incidence works are collected addressing the same outbreak events. So you have other means of collecting data, but to get the outbreak data, maybe there is an epidemic here now, and then you need to collect within a short time what is going on. That situation cannot be repeated. But we can get data, especially for diseases that are endemic. For endemic disease, you can always get data from hospital that people come to report and all of that. Go, next one. Now, before statistical methods are used to understand and control the epidemic, statistical models are needed to address the data generation processes, which not only include the epidemiologic and biologic processes that give rise to the disease outbreaks, but also the process that dictates how data are observed and how a case is documented and reported. Yes. Now, when talking about fitting model to data, we tend to think of one type of model designed for a specific purpose. Now, most times when you are trying to fit a model to data, one of the best ways to do it is also to have more than one model, so that you carry out what we call model selection. So by model selections, you find out that, in fact, when you are doing some of these machine learning stuff, there will be so many models, and then there is going to be a kind of what's it called? You will need to make some choices based on how the model perform. So the one that is having the lowest, I've forgotten the
Root square
error. So you pick from
absolutely.
Yeah. So I can't get information criteria or BIC, variation information criteria. So the one that gives the least of is the one we pick as the best model. So if you're also doing a mechanistic model, we also carry out that kind of method to get the best model that can fit that particular data model. So the population pedagogical model, which depends on tacit assumptions of the individual model nested within it, and the statistical model that leads the transmission process to the data generation process. Yes. Can we move fast? Okay. So Statistical models are data driven. So when they do data, you can't do anything there. Data driven. And then they explore correlation. When you make correlation is association between two variables. You know, the difference between correlation and regression. Regression shows relationships. So you may believe that in the house with somebody, but you may not have any relationship. So that is between correlation and regression. So regression shows relationships. So understand trends and pattern in data. And then it also goes with time series analysis, which is very, very important too. Now, for malaria, time series analysis. Now, we have various kind of methods for that. We have the ARIMA, we have the SARIMA, we have the spectral analysis, which compose signals into frequency domain. We have many of them. We have the wavelets, which they compose time series analysis, time series plots into frequency and time domain. And then we have the Arimax. The Arimax also include exogenous variables, Arimax and SARIMAX. You know, for Arimax, you can use malaria data only. But for Arimax, you can include other data, maybe like NLIN, ACT, and then you want to check, you know, time series analysis prediction based on those data. Yeah. Or you also involve climate, climatic variables and all that. SARIMAX and ARIMA. Now, so you use ARIMA when the data is showing a trend, and then you use SARIMAX when the data is showing signal pattern. You understand? Seasonality in data. Use that. Now, so we use for nowcasting and forecasting to predict the current epidemiology where it might be in the next few weeks. So one of the way we applied this thing was in our university, we asked them to give us the data for the past 10 years. And then we said, okay, we want to predict how many number of students we will have in the next 2 years that the school should make plan. So we did it and we sent it to them. That this is the prediction we are seeing. The next 2 years, the school is going to have this certain number. So how many classes are you going to prepare for? Now the population of students is going to skyrocket more, the people in Oriente. Yes, it means that so many people we have to relocate. They will leave their people, not students are now going to be more than the people in the land. So you can, with that, you see how strong the power of mathematical model is, even speaking from now. Now, so you want to know what will happen in the next few weeks. And then it gives you some certain confidence interval forecast to predict the current epidemiology. Statistical model may also be used to estimate the efficacy and effectiveness of current treatment and prevention measures. But one thing that this lacks, move to the next one. Okay. The statistical model are just functional approach. So they only take care of surface level information about the disease, not the internal dynamics in terms of non-linear processes that goes on. Now, when you say incidence, there's something that brings about incidence. Incidence does not just come. But what the data have, what the data you are working with is incidence. So there are underlying things that the incidence is not giving us. So in my model, you know, the statistical model does not capture transmission dynamics. Yes. So the non-linearity nature in disease. You understand? So that's why we now speak about dynamic or mathematical model that show the non-linear aspects, the non-linear processes that goes on in mathematical modeling. Now, in disease progression, dynamic model uses mathematical language to describe the underlying biological and behavioral drivers of disease transmission. Uses mathematical language to describe simply mathematical language to underline behavioral drivers. So mathematical models once validated against historical data can be used as tools for scenario analysis. So you can use it if you have validated it after validation. You can talk about Now, if your model is now capturing what is going on in data or for that disease, you can use it to build scenario analysis. Scenario analysis provide evidence to support policy making, allowing the exploration and compare of options of intervention against a disease to support decisions aimed at controlling that disease. Next. Now, simulate process. Now, for what mathematical model does that is simulate process, and then we could have it deterministic. Deterministic in saying that does not have random, no randomness, no stochastic. You understand? Then it could be stochastic in nature. If it's stochastic, you want to explore outcomes, you want to obtain the distribution of the outcomes. Randomness is important when it's stochastic. And then we also have meta population. When you want to model at spatial level, take for instance, I'm trying to develop a model to capture malaria transmission in Nigeria. That's a very complex one. Because you have to first of all, the first thing you have to do is to have a simple maybe let's take an SIR model, and then you are going to have I equals to 1 to that 6, but at 7 states. So, and then you have to also factor the fact that how people move, the movement of people, like how people commute. Let's take, for instance, I want to do that for just Abuja and which state is close to Abuja? Nasarawa. You know, some people live in Nasarawa. Somebody live in Nasarawa must be to buy things there, and he came to fall sick in Abuja because he works here, right? He slept in Abuja. So where people sleep at night, in course of trying to capture meta population model. Now you see now that's for 2 states now, just for 2 states. Now I have to capture the commuting into my model. How people commute from one location to the other in my model. You understand? So and other exogenous factors that affect the movement of people from one location to the other. So because that is special. So the special can be in 2 types. It can be a district, right? Which is in terms of when I say district, it means 1, 2, 3, 4, 5, 6, you know, just few numbers. But when I say continuous, it has to be partial differential equation, which is more complex. But I mean, that one is not always discussed when it comes to this kind of class. So, but for this, I mean, to do a simple one, I can capture Nasarawa and Abuja. Now, I mean, once we can get the way people are moving from here to here, and then we do a special distribution, special modeling of the population of malaria in Nasarawa and Abuja. Or we can do for the whole of Nigeria. It's going to be highly computational. And then time consuming, expensive. Okay. So you also need a good computer to do that. And network. And that's then those are under dynamic model. Then individual based. Individual based is actually based on a mechanistic model. But it's now done in an exponential. That one is done in an exponential distribution. Because you are taking each person. How many of us are here? Maybe 50. This one is S. Another S. So if you are 50, S1 up to S50, then I1 up to I50, then E1 up to E50. So you are taking each person in the population. So the person that built that model is the one that controls the model. So the model is being controlled from America. So I don't want that kind of project. I want to use what I control from here. So that I will not. So you know, I used to tell my students that I don't want to Kubo model. Are you guys that? It's to Kubo. So we want we tear over that we can make here. Are we getting it up? So and that's why we are evangelizing this. Go down, next one. So district model use all numbers, which are, I mean, when you say district model, they are very simple models that can just be used for a small population. Go down. Now, stochastic models, look at it now. You see a stochastic model, it explores outcomes, obtain distribution, and then randomness, you find out that now one good thing about stochastic model is that you see now, as at day 5, right? Day 5, how many people have been infected? Number. Who is going to tell me? Huh? No. I mean, yeah, 50 is the maximum, but between something and 50. You can see now. It's between 0 and 50. What does 50? So that's one good thing about stochastic. It gives you an interval. So you can run the simulation many times and it gives on interval, not on fixed estimate. So next, metapopulation. You can see metapopulation. The concept of meta does not originate in epidemiology. It's an ecological concept. Now, a metapopulation is a group of population of the same species that live in spatially isolated areas but interact on the same level. So, just like people here and then people in Nasarawa, and then metapopulation occur when different populations live in fragmented habitats but are connected through migration. So somebody is in Nasarawa, and then comes here every day. Yes. Next. So metapopulation epidemic model consists of n patches. So the population of each patch is assumed to be homogeneously mixing. They are homogeneously mixing. And then it is divided into typical epidemic passes of successive. So for you to do a metapopulation model, you can start from the basic SIR and then you split it into patches. Network model explicitly track the network of contacts between individuals. Like network of contacts. How many persons did this guy contact in one day? So they want to like contact tracing. You want to, so if I'm able to get now this guy is infected, how many persons did he contact? So then infection can only occur between infected individuals and the subset of the total population with which they are in contact. Next. Now individual base. So this track what happens to each individual in the population. You can see them. You can see. So allow to determine whether or not they become infected and infectious at each time step. So, and each agent or important group assign a compartment. Each agent, you assign a compartment. Next. So number of compartments can increase exponentially. That's for individual base. Each agent has a set of attributes like vaccination status, different kind of stuff. The rules are set for how agents interact. So they are the ones that set the rule from America. ITN or E-mode, they set the rule and then you cannot control it. So each year they input anything they like, they have seen there, and then you run it here. Yes. Rules are set for how agents interact. So they set the rules for you. You don't set the rules. Yes. Next. Then we have the economic model. So I use primarily to explore the potential costs and benefits of health interventions. So these are another aspect of mathematical modeling. Some people are actually focusing on these health economic models. They are used anything on health economics. I have one guy when I was in Oxford group. He's based basically in this area. Yes. Next. Now look at statistical models. How much complexity do I need? Now the statistical models, you see that it starts from univariate linear. Univariate linear, that's the simplest. Now, the next, multivariate linear. Now, when you're having more than one variables, right? Then it goes on generalized linear. The next, generalized linear and mix. So now, increasing realism is becoming more realistic as they are becoming more complex. But you know the challenge is that as they are becoming more complex, they are decreasing intractability. Track there becomes more difficult. It's true. So Next. Now, for a dynamic model, you start from deterministic models, which are continuous or discrete. These are the simplest deterministic model. That's the simplest deterministic model, continuous or discrete. But now, just like George Box said, by the principle of parsimony, said all models, I mean, he said that a model should be as simple as possible, but not so simple. So now, as to leave the details, and then you have stochastic models. Now, the stochastic model involves the randomness and all of that. And then the meta population and network models. And then you have the agent-based model. But the challenge is that as you are going down, increasing in complexity and realism, they are decreasing in tractability. So they are not easy to track when they are getting more complex. Are you getting now? So you have to be able to weigh the two together. Okay, so but there is a way that you can develop a deterministic model and then introduce some stochastic fluctuation into the model. Introduce stochastic fluctuation into the model. So it becomes a stochastic differential equation. Or a stochastic deterministic fundamental model. Now, a good model should be parsimonious, yet realistic. That means it is simple but not so simple, like the P-box. It should be simple but not so simple. Then it should conform to data. A good model should conform to data. Balance of conformity and parsimony is very important. And then easily generalizable. Easily generalizable. Validate model and make predictions. Should be able to relate to your model with what's going on. Then, so limitations. And so you have models present a situation of reality. Right? Because if your model is now more complex than the real one, then there's trouble. Yes, because it's supposed to be a simplification of reality. So if your model is not conscious that what the malaria is there, there's trouble. So it should be as simple as possible. You know, like, do you know when I read about UK food amount? The model that two groups developed the model. Very simple model. And that was what the government used to make policy in UK. Yes, that was like in the 1990s or 2001. Food amount. If you want to do that, I'll show you. By Mike Ferrari and all of that. So, I mean, then another thing is chance events of infectious disease transmission in that perfect prediction. Chance event, that's randomness. Randomness, there is randomness in transmission. And that was why I said, now, most of the time in our model, beta is always exponential. But it's not like that. Naturally, it may not follow a exponential distribution. Maybe a Poisson. Because so many things can inform transmission. Social interaction can actually affect transmission. Climate, a lot of things can affect transmission. So it's not like it doesn't have to be exponential. So then a good model suited to its purpose. I mean, simple as possible, but more simpler. Then balance accuracy, transparency, and flexibility. I'm going to explain this afterward. Accuracy, transparency, and flexibility must balance the three. Number three, it must be parameterizable from available data. You must be able to parameterize. Yes, test. Model infection and non-infectious disease. So infectious disease includes infectious disease caused by microparasites. We have like virus, bacteria, protozoa, and fungi, and prions. That's microparasites. Okay? Now, there's a way you model microparasite. The way you model microparasite is not the way you model macroparasite, though. Macroparasites, they are helminths, anthropods, schistosomes, right? And others. So microparasite, it makes sense to divide the host population into few classes also. So you are modeling the infection status for microparasite. infection status of people, susceptible, infected, and all of that. But it does not follow in a macro. I'm going to tell you now. Now, our operational definition of a macroparasite is indeed an organism whose population can, to a sensible first approximation, be described by some such compartmental model. Next. So macroparasites may be thought as those having no direct reproduction. That's a macro. Within the definitive host, which embraces most parasitic helminths and arthropods. So macroparasites are typically larger and have much longer generation times than microparasites. So while the generation time often being an appreciable fraction of the host lifespan, microparasitic infections are typically of a persistent nature, with us being optimally reinfected. So you may not necessarily die, but you have some disability, some brain problems, some skin issues. For macroparasitic disease like schistosomiasis, trypanosomiasis, leprosy, I mean, a lot of them like that. You know, so and then for macroparasite, the various factors parasiting the, you know, in macroparasite we put the one body, not the infection status. The one body, whether it is low, it is high, it is medium. So there is a different way you are modeling macro. Is different from the way you model micro, like malaria. No model micro the same way you model macro. So we are modeling the interactions and output per female parasite, pathogenic effect on the host, evocation of an immune response in the host, parasite death rates, and so on, and can all depend on the number of parasites in a given host. Next. So mathematically, this means that the relatively simple compartmental models must be replaced by more complicated models, which take full account of distribution of parasites among the hosts. So that was why I was talking about one body. So operationally, our definition of microparasite is one whose population biology requires a full distribution of parasite among hosts. That's we are modeling for infection status. So from a public health point of view, it is significant that for many macroparasites, a distinction can be made between infection, that is harboring one or more parasites, and disease, harboring parasite body large enough to produce pathogenic symptoms or even death. Next. Now, for a macroparasitic disease such as smallpox and all of that, it is reasonable to assume that a given host does or does not have smallpox. So for a macroparasitic infection like hookworm, like schistosomiasis, there is a real distinction between infected with one or two worms and carrying a worm body large enough to cause illness. So that's why you don't model schistosomiasis or female genital schistosomiasis or leprosy or trypanosomiasis and all of those diseases that are NTDs, that neglected tropical disease. When you model microparasitic, malaria is under microparasitic. Lassa fever, all those diseases that NTD, NCDC, they are capturing, Nmep, they are all micro. So you model them according to their infection status. But any model that has to do with macro parasite, macro, helminths, arthropods, they are to be modeled differently and they are modeled according to one body. Whether the body of the egg, one body is high, is low, is medium, that's the way it's modeled. It's not modeled the same way. So now, there are some microparasites that cannot be captured by compartmental modeling only because there are aspects of the disease dynamics that shares characteristics with microparasitic disease. Like, take for instance, Rift Valley fever. Rift Valley fever. Go down. Then you have like modeling of non-infectious disease involves using mathematical equations and algorithms to simulate and analyze projection and behavior of diseases such as cancer, diabetes, cardiovascular disease, neurodegenerative disease, like I was talking about cognitive decline the other time. That's dementia and all of that. All of that can be modeled. Chronic respiratory disease, mental health, and all of that. There's a project we have with UCH dealing with mental health in young ladies for the next 3 years. So I mean that's another aspect you use modeling to capture. Yes. Now, mathematical model can describe disease mechanism, predicts disease progression, identify risk, and then optimize personalized medicine approaches. Yes. So under this non-differential, you can use ODE, PDEs, stochastic differential equation, agent-based models, network models, and machine learning algorithms. So some examples of mathematical model for non-infectious disease, they include logistic model for if I don't have any. See, next time you provide a whiteboard, so that someone not like this can write something, and so as you are talking now, my hand is already moving. I didn't know where to put it. Maybe I should put my answer in my pocket. So the compartmental model for diabetes progression. And then we have some model like this is already ready-made model. Piece of the Nangumo model for cardiac. Then Alzheimer's disease model uses stochastic, and then COPD model uses agent-based model simulation. Next. And then this model can help researchers and clinicians understand disease mechanism, develop personalized treatment plans, improve public health policy. Next. Formulating a model for a particular problem is a trade-off between 3 important and often conflicting elements. Number 1 is accuracy. Accuracy has to do with the ability to reproduce the observed data and reliably predict future dynamics. It's clearly vital. But whether a qualitative or quantitative fit is necessary depends on the details of the problem. Now, when you are dealing with accuracy, you are looking for, because every predictive model must be must have high level of accuracy. Predictive model, you must be able to satisfy the condition of accuracy. So a qualitative fit may be sufficient to gain insight into the dynamics of infectious disease. So that's the basic one. But a good quantitative fit is generally necessary if the model is to be used, can you see that, to advise on future control policy. That is the demarcation line between academic models. For those of us in university lecturers, there is a distinction between academic models and policy-driven model. Yes, they are different. Academic model, I sit in my office. The head, the team. The eye did that. They did that. You do all the analysis, all of that, you do everything, you submit the paper. Nobody use it. So we have 2 types of model, academic models and policy-driven models. So policy-driven models, the question must not come from your brain. The question is to meet the demand of, let me tell you something. If I want central bank to help me do something, you know what I will do? I just want to give a glimpse of what I've started doing. I just find their problem and solve it. You understand? I want central bank to do something for me, for my center. I look for their problem and I solve the practical problem. I solve it, publish it, then submit to them. Then they will look for me. They will look for me. I will send it to the MD. You will look for me. You are a freelance man. Then you will start becoming a special person when you Okay, I want to solve problem for these people. Find the problem of World Bank, solve the problem. World Bank will do for you. I've already joined my time with the so the second stuff. So now accuracy generally improves with increasing model complexity. And you see now, as the model becomes more complex, the accuracy of the model improves. And then the inclusion of more heterogeneities and relevant biological detail. That's what makes your model to be more accurate. Next. Clearly, the feasibility of model complexity is compromised by computational power. That's it. You know, that kind of computer you are carrying cannot do anything. No. To do an accurate model, you just see that the thing will just pan up. You are running from morning to night. By 9 p.m., the thing, they say your computer has crashed. Because what you are carrying on your neck as a computer is just a toy. You cannot do anything. Just to type something, do some pie charts, and the computer you are carrying. You want to do accuracy model, then you need to get good computer. It's not the one that is doing pie chart. Now, the mechanistic understanding of disease natural history. That's what I was telling you the other time. Mechanistic of underlying process and the availability of necessary parameters. Consequently, the accuracy of any model is not always limited. Then you talk about transparency. That's what your model must satisfy. Accuracy. The next one is transparency. Transparency comes being able to understand. You want to understand. So that is what I call the descriptive level of model. The other one is analytical level, a stronger level. It's just like descriptive epidemiology and analytical epidemiology. It gives you how and why. The other one gives you where, when, and all that. So transparency comes from being able to understand how the various model components influence the dynamics and interact. That's the level many of the models in Nigeria have in the academia. That's this level, transparency. They just want to understand and then they develop the model, they send it, they do the numerical, something, and publish it. But that's not useful. You just want to understand. That may be a beginning, but that should not be the end. Yes? Now, this is usually achieved by successfully adding or removing components. Note, like say, if you ask somebody, say, what do you do in this model? I'm modifying the model. I try to add this and then remove this and all of that. I'm building upon general intuition. Can see now, it's general intuition. Not based on questions from programs, not based on questions that is relevant to what is going on in the country as far as maybe Lassa fever is concerned, or mpox, or cholera, or all the disease that we have. There are many problems in Nigeria. I'm telling you, a lot of problems. I cannot myself, I can't finish them. You find somebody is doing somebody is doing in Nigeria's academia, people do malaria, and then you move to another disease, and then this. If you check all the paper, they are the same thing. Check all the paper, it's only one thing. If I bring 100 paper, say this 100 paper now, everything there is just one thing. Why? Just change this one, remove this, change this. It's just one paper. But that's not, you see, that's not the angle. If you want to do policy-driven model, it has to be from the questions. Some cannot even identify objective from methodology. You know, maybe if you have time, we have to discuss about research. Because that's another evil part in Nigeria today. You know, when I go around, I see many rubbish. I was somewhere last week. Many rubbish. I could agree. And if we continue like that, we can't compete with the world. In terms of grants, you cannot get grants. Well, who will give you grants? When you cannot distinguish between objective and methodology. That's a crazy beginning. So, as the number of components of model increases, it becomes more difficult to assess the role of each component and its interaction with the whole. So when it's becoming more complex, it's difficult. So transparency is therefore often in direct opposition to accuracy. So flexibility measures the ease with which the model can be adapted to new situations. So that means the model must be flexible to the point that if I develop this model for Abuja, I can easily adapt it to Kebbi State and it will work. That's flexibility. Your model must not be so rigid that it cannot be adapted, especially when it's a data-driven model. So, and this is vital if the model is to evaluate control policies or predict future levels in ever-changing environment. So most mechanistic models are based on, on well-understood disease transmission principles and therefore highly flexible, whereas black box, time series, neural network, machine learning, that will be able to accurately reproduce a given time series unreported and less amenable to a modification. You can't touch it though. When it is machine learning, you can't touch it. You can't touch it. You give it the way they are given. Right? Next. How many minutes? Next. Models have two distinct roles: prediction and understanding. Or understanding will also be insight. Right? So which are related to the model properties of accuracy and transparency. So it means prediction is accuracy, understanding is transparency. So if you want to just understand the disease spread, what you need, you want to understand progression of disease, all you need to develop is a model that speaks to transparency or a model that speaks to understanding or gaining insight of the dynamics of that disease. And therefore, they can be in conflict most of the time. Because, these are things I can discuss a few minutes after now. So, we usually require a high degree of accuracy from any predictive model, whereas transparency is a more important quality of models used to improve our understanding. You just want to understand how the disease is spreading, just like COVID. Like COVID now, COVID is an age-structured disease model. Why do I say that? Now, the reason why I say that COVID is not, an heterogeneous, it should be an heterogeneous model. That's age structure. That means demographic, age is demographic. So, because the population pyramids of each country are different. Now, you find out that in countries in Europe, now, people who are most affected by COVID, they were the aged. People who have underlying issues, compromised health states and all of that, right? But in Nigeria, you find out that we have the young population are more than 60%. So people have COVID, they just poor, move. And then they started doing their stuff. Because, when we were doing COVID modeling in some Oxford group, they were asking me that, I was the leader for Nigeria. They said, by now, they thought that many people in fact, that was their thought. Somebody called me, this wife, told me and said, Nmep, I don't believe what's going on. By now, they thought Nigerian health system would have collapsed. Yes, but the problem, initially people did not think in the direction of what is the population pyramid of the country you are talking about. So in terms of disease, you also have to think about, the aspect of the heterogenetics. That's what I'm talking about. The age, the sex. We're studying something, some people were doing a study on Lassa fever in Liberia. And generally from Nigerian story that I read from National Lassa fever strategy back from 2022 to 2023, I have it on my app, I read it. They said Lassa fever affect all sex and all of that. But for Liberia, it's not the same. Females are more affected in Liberia. So it's a sex structure model in Lassa. Lassa fever is a sex structure model in Liberia. But in Nigeria, it's normal. Everybody carry it, it's normal. Right? So what we are saying here is that, you see now, all those things I'm talking about, they are introducing more complexity to the model. Now, prediction is the most obvious use of model. It requires that the model is as accurate as possible and therefore includes all the known complexities and population level heterogeneities. Next. So predictive models can have great power in specific situations, guiding difficult policy decisions where a trade-off between two or more alternative control strategies. Like the case I was mentioning, it is interesting to contrast how models were used using the 2001 UK foot amount epidemic to how models were used to investigate the control of potential bioterrorist releases of smallpox. You know, that's an aspect I may not really want to talk about. There are some, you know, viruses that are being cultured in the lab. We can just introduce them now. Another problem will start all over the world. And everybody will be kept at home. You know, and you know, when you see a virus, it can always, you know, mutation, stress. So both of these scenarios called for detailed, accurate predictive modeling. Next. So during the UK foot amount epidemic model in 2001, two primary questions were addressed using models. First, was the epidemic under control? And second, whether additional targeted culling would lead to a reduction in the total loss of, you know what culling is? When you kill indiscriminately all the animal. You don't know whether this one is infectious or this one is susceptible. Just kill indiscriminately of animals. And that was what they did. You can't do that for human beings. It's unethical. If you try that, don't say that no one that touch models. Three distinct models were used based on different judgments of the known dynamical complexity. So you can see three distinct models we are used to make judgments, different judgments of the known. So each of these models have their own advantages and problems. But fortunately, due to robustness of the problem, all three models provided similar advice. So a large-scale epidemic was predicted, and additional locally targeted funding will reduce the overall loss of livestock by dramatically reducing the number of cases. That was 2000. The paper was published. One of the guidelines. And yes, next. So accurate predictive models can have an additional use as maybe, you know, several clusters is part of a localized epidemic. Like when you say localized, you know what I mean. To actually be able to predict a threshold number of cases of which prompt action is required. So similarly, during an eradication, regions that do not respond as rapidly as the model predicts will be detected and targeted for more intensive control measures. So now sometimes you may say, this model, you do not really say anything about this aspect. No, don't keep quiet. You know, you said here that during an eradication campaign, regions that do not respond as rapidly as the model predicts will be detected. They should be diagnosed, tested, and checked further realistically and targeted for more intensive control measures. Now, finally, detailed modeling and robust analysis of reported and observed cases may be able to identify early emergence of an epidemic. Next. So models can also be used to understand how an infectious disease spread in the real world. Yes. Can you move? I want you to move. Okay. Models. Hold on. Models also have their limitations. So it is possible to build a fully accurate model. There will always be some element of the host behavior or quack of the disease that is unknown. There are some aspects that may be unknown at certain times. So that's why if you're a modeler, you have to be current. You have to be current. You have to keep reading because things change. Disease transmission change. So many things keep changing. You understand? The way I was modeling malaria last few months, not the way I'm modeling malaria now. I'm telling you the truth. Yeah. has changed. Some things have changed, even in model structure. So if you don't continue to read, then you are off the track. Consider trying to make an accurate model for a human airborne disease. Such a model could need to account for variations in the transmission with temperature, climate, capture the day-to-day movements and interaction of individuals, encompass variability and susceptibility due to genetic factors or past infections. Do you know that nutrition also plays a role apart from genetics? Nutrition. So even if such a model could be built, the chance nature of transmission will still prevent perfect prediction because transmission is fuzzy. Now, we will never be able to predict the precise cause of an epidemic or which people will be infected. The best that we can hope for is models that provide confidence interval. That was what I was talking the other time. Interval estimates on the epidemic behavior and determine the risk of infection for various group of hosts. Next. It is clear from what has already been said that no model is perfect and no model can accurately predict the details process. However, two people, okay, now. Before, okay, before technological requires a wide and globally. And the ability of stakeholders is the focus of this course. Techniques like educational tools that you can use and techniques and points us to general materials that provide an introduction. So we go about modeling by first considering the and now you are working under macro parasitic modeling. Micro, not macro, micro. So the model is about infection status. Now, if you delve into entities, you are modeling from the viewpoint of macro, which has to model one body. So there are two different worlds. You have to note it. Now, we then proceed to express these assumptions in terms of mathematical equations, which are then analyzed. Next. Now, the actual process of analysis usually involves computing the solution numerically because the models are often analytically intractable. So you can't analyze them, like that. So because they are highly complex models, a variety of off-the-shelf software may be used to solve this, I think Model, Beta, and Stellar, and then we have other ones like Maple. Maple is also good for that. Numerous scientific computing packages also permit quite sophisticated models such as mathematical, Maple, R, Python, MathCAD, MATLAB, and low-level language like C and Fortran. So our personal preference is to carry out nearly all model analysis code written in R. That's what we use best. Now, a sound knowledge of statistics is obviously an essential asset, allowing us to link models with available data and providing a framework for analyzing the results of model simulations. Now, statistics therefore has three main purposes in epidemiological modeling. First, it allows us to analyze any data that are available and to use this information to derive parameters and associated confidence interval per model. Second, statistics provides a powerful set of tools to compare model outputs with available data and then with general aim of showing that the model is a good fit. Next. So finally, statistics can be used to compare the results of multiple model simulations and so elucidate the differences between them. This is particularly important if the models are stochastic, you know, they are random in nature. Statistics itself is a very diverse subject area, and no single publication will possibly cover the whole discipline, not the side. Sorry. Now, statistics in theory and practice, these are some books. You know, Markov chain is a suitable primer for the rapidly expanding field of MCMC and Bayesian analysis. When we are lucky enough to have a long-term case reporting data for a particular infection, then techniques from time series analysis become important. Now, when you have long time, like maybe 10 years, 20 years, and all that, although technically part of the discipline of statistics, time series analysis is a subject area in its own right, with many powerful tools that can be used to examine longitudinal data and to extract meaningful patterns, such as periodic oscillation or density dependence. So the two books, time series analysis, dynamic system approach by Overton and all that, review the range of techniques and possible outcomes. Yes, application. Next. So for a more model perspective, both dynamical systems and numerical techniques play important roles. Dynamical systems provides an understanding of model behavior in terms of fixed points, attractors, and stability. Those are people who are interested in their qualitative approaches. Good. So numerical techniques are often important. The models that are developed are unlikely to be intractable. So therefore, it is imperative that we can compute solutions accurately. So move. So these are between ecology and epidemiology, with many ecological concepts possess in the absence of infection is a necessary techniques are provided the epidemiologists with unparalleled insight into the dynamics of infection within the host and how pathogen operates at the fundamental. So, sometimes we also add some molecular you have in the field. So of immunology and genetics. If epidemiological models are to take advantage of the body of knowledge that If you want point, I would have pointed. That's the best. Started from 19. They have like that. You can see very so it started from Ross, the medical doctor. And then move. People started doing a lot of work on malaria. Then let's move.
The internet, crypto.
I'm rounding up. So, and then we have also contributed. Go down. Okay. So wait. This is what special dynamics of malaria. This is the one by touch towards malaria. This is a mechanistic model approach. Yes, fish. This is the mode that the malaria don't have them format. Then this one of our work. I mean, behind this one for to infectious disease modeling is a LMI transmission tape state. Yes. And then yeah, this is okay, yeah, this is the work that has been sent, but we are undergoing revision now. Malaria and pregnancy. Yeah. That potentially accepted, and then we are doing some little work on that. Supplements and validity in Nigeria. Yes. And then becoming a modeler. These techniques, if done in concern and as part of an international response to pragmatic questions from policy leaders and the extreme powerful tools to support countries fight against disease. So to become adepts at any of these three fields requires years of study and practical experience. Before beginning to study the knowledge of mathematics, differential equation, linear algebra, equilibrium analysis, and direct system and all that, you need it. Next. So next. Thank you very much for your time.
Right. You will agree with me that that was very elaborate. Oh. All right, that was very, very elaborate. And I think Prof may have to sit down. Please, you have to sit down, sir. I Alright, so give us numbers.
Mathematical modeler. It's an eye opener, I can really say. A lot has been said. And thank God I'm here. I was so discouraged. That was sponsorship. I've been following you online. And one of the things I have learned today is, doing a policy driven model. That's aspect I want to go into. Before my first degree, I that now. How do I get now? I'm looking because we're talking about that paper. Oh, my laptop. I was just laughing. Rob, I need help. You should not stop there. Thank you very much.
Things are useless. Now you have to be careful of that. It's not about quantity, it's about quality. So the thing is, now I said something when I was talking that the first approach to modeling is question-based. And the question does not come from mathematics, it comes from the biology. So you say you are working on cholera prevalence in where? So now if I want to ask question from that perspective, I think my question would be, and what level of the prevalence of cholera in that particular location? And then when you say prevalence, we are talking about old and new cases. You understand? Talking about both old and new cases. So there's that. Right? So and you have to remember, if you have data, you must start collecting the self-evidence data. It's a cross-sectional data. So you can start from there. So if you get the data, You have to first sit down, understand that data, because when you see a segregated data, it's always very large. You really have to understand the content and know the aspect you want to use. Are you getting it? But what I'm going to say now may not necessarily completely help you. You may need to come from maybe as in even if you have to spend, are you getting it? But if it's better to be able to respond to that question in that location, because we are talking about federal mental okay, so I think that's my answer to your question. Answer is it only two questions? Is it only one?
I think it's essentially one.
One. So I was saying that you cannot make policy without data. You understand? And so the data speaks about the timing, it also speaks about the location, and also speak about the population, the people. You understand? So and disease is about people, it's about time, it's about place. So if government is going to do anything now, if you have that kind of data and you publish it, they are looking at that place. They are also looking at the people in that place. But if you just model and say cholera model, you know the model, you do everything, it's not speaking to any population, and then it's like just a transparent model, or just to understand the dynamics, which have been done. So I think the first approach to modeling is to start from the question. And let's add the answer after the question is objectives, I mean, so and then at the end of the methodology, we have expected outcome. What I'm expecting, maybe my result, my proposed results, because I'm still coming from the point of view of proposal. So now, my outcome, if I'm going to discuss my outcome, my expected outcome is that the methodology one, what is the outcome? Expected outcome one, methodology two, expected outcome two, or expected result. So and then you discuss. Your discussion should be based on past work. Discussion does not talk about repeating the same thing. That means people have done this, people have done that. How does what people have done, how does it relate to what you have done? Or how does it negate what you have done? So in science, you also report negative results. It's not a crime. Are you getting me now? So, and then you talk about conclusion. So I think that's the in modern, that's it. You see, whether you are in science, you are in math, you are in social science, that is the conventional way of putting out research. Whether you are in social science, you are in art, you are in math, you are in this, you are in that, conventional way, anywhere you are. If it's not done like that, it's not done. Thank you.
Thank you so much. All right, thank you so much, Prof, for the elaborate presentation. My name is Timothy, once again. My first question is coming from the angle of public health experts. You did the calculation by presenting with respect to the issue of the need for malaria vaccine, and then you came to the conclusion that everybody needs, to be vaccinated. If you look at the burden of malaria in Nigeria,
it is actually huge, affecting especially children and women of reproductive age. It's cause of concern. As a mathematical modeler, or a researcher, coming from the angle of bridging the gap between research and policy, and let's say policy and practice. What have you been doing? I mean, as a research body now, to actually, present to the Nigerian government a sort of technical expertise or advice in order to be able to actually brace up, with respect to the acquisition of, malaria vaccine. We know that yes, the production has not been rapid, but we know that malaria vaccine has been in its production. That is a fact, quite okay. But it has not been rolled out, to the public in such a way that everybody will have access, to the vaccine. What you have been doing in that respect in order to have, government policies, being, formulated and implemented with respect to malaria elimination in the angle of probably preventing, contracting, malaria infection. That is one. And then two, this is coming from the angle of a development professional. Can we also have this mathematical, modeling with respect to other development issues, concerning governance and let me say by extent, extension to livelihoods? Is it possible to have mathematical modeling in these areas too? Thank you.
Okay, I'll start from the last question.
Yes.
Yeah. Mathematics has decided to marry everybody.
It's a polygamist.
So when mathematics had marriage with medicine, become mathematical medicine. When they had marriage with economics, become mathematical economics. When they married English, become mathematical English. When they married psychology, become mathematical psychology. So anybody that comes to math will marry you. So even that aspect you say, there is mathematical for the developmental for the all of that. Even for politics. Now I was talking about corruption the other time. Those are social problems. We can in fact, there is even one that because I don't want to sound too that's why I talk about. Are you getting it? So we also trying to put up that kind of thing so that people can understand. So the thing is, what we are now, the first question you without evidence, evidence-based. I mean, so what we are doing now, the process we have now is to train people. We are already in the research to bring, we are doing research to bring out results so that at the end of the day, we come up with evidence-based results that can prove some of the things what we have said. So we don't just want to say this is happening. We know what's happening, but let research be the backup, like published work. So we can now, if we are publishing a work, I will tell the story there. From the story, the government can see, oh, this is what is going on and all that. So what we are doing to get that done is research. So research is ongoing. We have people who are working on vaccination. In my group, we have people who are working on melanine intervention. We have people who are working on SMC. And, there's a process of publication that is going on. And then all of that will make known to the public. Thank you, President.
All right. Next person. Okay.
Thank you very much for actually responded to some of the questions I wanted to ask. Just that government actually picking up these recyclers of their policies. So notwithstanding, we might not be here to answer for them. So the question I had, I was asking myself, because looking at most of the publications I've been reading about modeling, geospatial, modeling, the distribution and all that. And I asked myself, can't this be summarized in terms of what are their major contributions to knowledge? What are the major optics that governments can pick? Because there was, as an example, there was a national data, not actually national data, data on mosquito distribution, anopheles mosquito distribution in the country. And from that publication, I think geospatial modeling was used to know where each of a particular anopheles stays in the country and all that. And afterwards, I think it still goes back to share. It still goes back to the question I asked of the malaria receiving mosquitoes in this south. Okay, in the north, at this period of time, we have another one that is driving malaria. So are there some interventions to hang out at this particular time or at this particular time? So in my own head, instead of making these elaborate publications, can't we just pick up these things and, okay, give it to government as a policy paper for them to take? So that's one. Then the second one, looking at all those things, because some of us that like reading what we don't understand. I see all those ARIMA, SARIMA, ecological image modeling, all that. How can they put up all these modeling facets into one paper? Because I just seen one when is going that. So, and most time it makes a whole lot of sense in malaria intervention. Instead of doing a blanket intervention, there are areas in the country, there are states, there are LGAs, there are communities where we have more prevalence than the others. So knowing all these things, can we use all this model to focus our intervention there? And like the one that is coming up now, rice farm communities. You look at the surroundings, you see that, okay, those surrounding communities have more malaria prevalence than others, than even the community that produces rice. So it actually gives us, okay, how and what do we think, what model do we formulate to tackle this? And that, so I think that is what, if you can help us clarify this. Thank you. All right, sir.
If you look at the picture, what do they do? You can't have publications. Everything you see on their platform is based on this publication. You understand? I think the government need to be serious with research outcomes. So that let's start from the health. We start from like NCDC, all this. So those are people that should go with updates of all these research outputs. There should be a unit there in the research and policy or something that gathers publications and give updates of, like when you look at NCDC platform now, you may not see anything. And when you go to the page, it's not what you say. That's why when you publish a paper and you got something from the page, you have to write dates inside that. The date should be that, because by the time I'm checking and go out the paper, I'm checking it's either they have added something that's what you do in your paper. But if you mention the dates, do you understand what I'm saying now? It may, maybe if I also put it to give me the exact something that I needed, So that's why you see that most of those websites, they are updated, or you go to CDC platform, they are updated from time to time based on computation. But so I think this work lies in the hand of NMP. NMP side, I'm sorry to say, you don't find anything new. So there are platforms, and now you see, was it last week I heard, there is one national malaria emergency on that. I think they are on the second reading now. Maybe yeah? Name. I heard. The government is trying to start another this thing that we be standing doing some. They want it to be doing something else different from NME, but I'm sure at the end of the day, I don't know. So you understand? So I think this platform, just like the way WHO does, we should have this kind of representation at country level, where all of these things you have mentioned, they need to sit down and gather those publications, do systematic review, bring them up, and then put them into use it as updates or publish something into their own system. And then it will mean that if you go there last week, by this week you are seeing a new thing based on publication, result, outcome, and all that. So I think that's the way these things should be done going forward. Then the issue of methods, different methods of doing modeling, whether from time series to other mathematics. You can, it's not possible to just plug all the different methods together. Because I was saying something the other time that the first thing that drives a modeling method is the question. So if you have different questions, you have different questions, you have different questions, the question will determine the kind of model you should use. So if I have to bring all of this together in one place, then it will be that I'm speaking on different questions at the same time, and then with using different methods at the same time. You understand? Some of the papers we presented here have different methods because the questions are different. You understand? Even you look at when I was showing the model of from Ross in 1980 and he developed his first model, with a model that have come after up to date, and people are still doing a lot of work in using a particular model to explore malaria. So it's difficult, but it's possible that if you're under a training and the training is towards maybe type series analysis and all that, so that, like what we were saying about how to know which kind of intervention to deploy, wavelength can do that for you. You understand? Wavelength analysis, it has this special ability, special correlation ability to be able to, if you have, it's a time series tool, but it is more dynamic in nature in terms of being able to, if you are comparing two cities together, it can help you to be able to know the timing of the seasonality in this certain place and then in this other place, so that you will be able to know where to deploy your interventions and all of that. So I think we have different tools based on the question you may need to answer at certain time.
All right, thank you. Next person. I think there was a hand up here. Yeah.
Okay, thank you. I just wanted to ask a quick question. Coming from the medical angle, what's the difference between statistical model, machine learning model, and mathematical modeling? Do they overlap? Do they do different things? You had said that the statistical model is superficial and you need data. But for mathematical model, I didn't get that part. So, okay. The thing that what we do in especially cancer epidemiology, we do a lot of very heavy data. Does it mean that we are playing?
Yeah, so you see now, statistical model are data driven. You understand? And basically, in statistical model, you study the functional approach in terms of you study the surface level study. You understand? It's just to get the patterns, the correlation, the regression, the relationship, and things like that. There are now, take for instance now, for mechanistic models, there are underlying issues. You understand? Like you are dealing with non-infectious disease. Now, these are not like communicable. You understand? These are diseases that develop over time. You understand? So now there are also aspects of mathematical model that some things that the statistical model not do. Now, that the statistical model will not be able to put out, that mathematical model will bring out. So that's why these days sometimes even machine learning models, they are all black box model. Black box is that you cannot amend anything. You can't touch anything. You are a user. But for mathematical model, I can decide to develop this model myself newly and then use it to capture the questions I'm answering. Do you understand me? So and then depending on the question, that's what determines the structure of the model. So for statistical model, everything is data driven, and then they study the patterns of the data, and then there are no underlying mechanism that's being studied under. So it's always surface. So those are the disadvantages they are useful, they are good starting points. Are you getting now? But they should not be the final point. They are just starting points. And good thing may also be that if you now have a time series data for cancer, then you can carry out, which is stronger than even the time. The time series is a subject on its own. Like you can even do more stuff better than a normal statistical model. So if you have like a long time series data or longitudinal data, you can do a lot of further analysis, which is stronger than the normal statistical model. And then you could see better things that you may not be able to see using a statistical model, normal statistical model. Now you might be looking at a model like this. Just if you use a time series analysis, you decompose the seasonality, you see many things, and by the time you use some of these time series too, you decompose the signals, and then you are seeing things that you may not be able to see naturally if you use a statistical model. So these are things you have tested, and then you can see the difference at different times. Yeah, thank you. Okay.
Okay, yeah, Steve. I have any question? Prof, does it mean that this mathematical model is new? Because in clinical epidemiology, there are no emphasis, even as of now, on it. In our training,
It's not
I wasn't trained on any part of mathematical modeling at all.
It's not new, but challenge.
It's always been there.
It has always been there, but if there are no experts, that recently, funds is coming. Fund is coming on that, and then that's why we are training more people. I told you of the modeling of mental health, a project with UCH. We have a project with UCH now, modeling mental health. Under still Bill and Melinda Gates, modeling of mathematical modeling of mental health. They are already admitting people now into that program. I mean, maybe by July or June. Modeling of mental health in adolescents, and we are using mathematical modeling. I think getting me now. So it's because now there is need for capacity building in that area. We lack such in Nigeria and Africa. So most of the people that have taught you in those days, that's what they know. No man gives what those out.
Is there a place we can build this capacity?
No, but everything, this is what.
No, this is 2 days.
Yeah. Is there. Icammda is in Nigeria.
Do you guys train?
Yeah. If you put some website, you see business scholar, that's this guy will give you the website, business scholar, and then internship. Okay. We have internship program, we have business scholarship. People have come from outside Nigeria. Yes. We have had people from outside the country who have come to learn. Thank you, sir.
I think currently the number of business scholars and internship we have brought currently with us, apart from people doing their PhD, masters, and postdocs who are currently getting trained. Those that come for physics team and all that are there. And it's a community where you can actually brainstorm and then help to understand the concepts better. So I think I will display the website going forward. And we also run programs across the country like that. For instance, now there's going to be a 2 weeks program in Bobo very shortly. That's next month, Benue State. So 2 weeks. We'll be there 2 weeks. And though it's just that the application process is over, so you may want to be on the lookout for the next one.
In December, I'm going to see that Professor already. So there's so we have a project with ICTP. So we have one in the University of Abuja in December, by the grace of God. So we got some funds from ICTP, National Center for Theoretical Physics in Italy. So we are hosting and these Abuja people will be hosting us in December by the grace of God. So you can the flyer will be out very soon.
All right. Thank you. Okay. Yeah. I think the last person. Yeah. Yeah, I think frankly it was the last one I gave. Thank you so much, bro. It's really an interesting and expository session. Yes, I want to ask, most of the things I wanted to ask have been actually addressed, but I just want to clarify also. Most surveillance data in Nigeria, I'm an epidemiologist by training. Most surveillance data in Nigeria are very complex when you look at it. You talked about some criteria for really understanding what's modeling approach to use for data and for outbreaks and even other diseases. Now, in addition to the question, after generating the question you want to answer for that research, are there other key considerations, especially for beginners like me, that when I see a data, I can say, okay, this is the modeling approach that can be applied to this data to be able to answer those questions, research questions. Thank you. Thank you very much.
Yes, so like if you have a data, that's why I said that there is need for studying the data. Right. You need to study that data. Now, what I need to study the data, you need to study the information around the demographic. Very, very important. Then the information around the infection. People who are infected, maybe you have who are tested positive or negative. And then the information about the population, the location. Because like anything you want to do, you need the location. But the location will also determine the longitude and the latitude and all of that. So, and then if you get that clear, now take for instance for a cross-sectional data now. Now, if it's a cross-sectional data, it's not the scale. The scale of the data will not involve time. You understand? So that means what you are doing will not be over time t. So you now have to check. If I don't have time there, then do I have age? So if I have age, there are two ways you can do that. So you can use a partial differential equation, and then you separate time from age. Take the age part because you are dealing with age. So when you take the age part, so because your data is age dependent, your model will now become age dependent. Are you getting that? So that is because most of the cross-sectional data don't have time. So because they don't have time, you cannot use it for for that particular study. But in a study where longitudinal data, and then you want to add the cross-sectional data in the data. So it could be that you are taking some parts of that data to add to what you have in the incident data. Are you getting that? So, and that may inform maybe some parameters in your model, and then your model will still be on time scale because you have an incident data is over on time. So these are things, you need to look at in terms of developing your model, either in terms of the scales that may be different from the normal scale, professional data and then incident data as the case may be.
Okay, thank you so much. And I think Prof, maybe just like it was answered for the previous person, I think training to be a good one, like for one get trained on how to, you talked about the experience of the modeler too. Yeah, so I think experience to it counts. As time goes on, know how to interact with those data sets too. So I think it's a good one we talked about Icammda the other time. Another, I'm not sure if there's any other, but at least I'm sure Icammda platform that offers such training. So anyway, when we get to that point, maybe after this session,
and
media,
and it's free. So
yeah, it's free.
it's free.
It's free. So that's a good thing. We should.
Sorry, I didn't get that. The last thing.
That the training is free. Training is free. The scholarship, internship, both free. Yeah. Sometimes we accommodate you, for the period of time you will stay. So you have accommodation also free. Okay. Now for the online participants, I think I have a hand up. Can you help me read the name on there? Is it just one person?
Bamhemba, Iba. Bamhemba, Iba.
It's okay.
Bamhemba, Iba.
Yes, I'm with you. Thank you very much, Prof. and the moderator. I guess you can hear me. Yeah, the network at your end has not been very okay, and it's quite breaking. But if you can hear me, I'll go ahead.
Go ahead.
Okay. Thank you very much, Prof. The question I wanted to ask, somebody actually asked that question, but I will make it a bit personal here. I appreciate the fact that you said our model should be policy driven. I'm a student who just got admission for a PhD program. When I stumbled across the mathematical modeling, I felt it's an area I should venture into. So I wanted to ask directly, how do I get into developing models, or how do I run a PhD program using the mathematical modeling for maybe one of the infectious diseases? How do I come in this time? I'm about starting, so I want to do something in mathematical modeling, especially with infectious disease.
Okay. I didn't find at least a question that you want to answer.
Sir?
Have you found a question that you want to answer?
Yes, I've been looking at LASA because, of course, I stay in Boko, so we'll meet in the next 3 weeks.
Oh, sorry, your network, we are not able to get okay.
Can you type it?
You can type it up, that thing will be.
It's okay. I think I will attempt to type.
So you can type, and another thing will be that you can reach out to Prof. I think the email address will be given to you. How are we going to give the email address? Now, should the media put it there? Because I'm not sure you want to. Okay, so media, please, can you put us a Prof's email address? So this person can reach out to Prof so that they can, because he's talking about starting a PhD.
So
I'm not sure.
my question is, have you found a question?
at a PhD in this area.
That's great. If you are not working, that's what I'm asking.
Yes, yeah.
I think a conversation has to ensue between this person and problem. So that help out to address his concerns. Okay, is person typing?
No, it's
Okay, you are putting up his email address, right? Is that what you're doing, Media? Okay, thank you. So once you have that, so you have Prof's email address, please. Please reach out to him. You can be sure that Prof will respond to you. Okay, thank you so much.
Yes.
Okay, so as it is now, we have to stop at this point. Please, can we appreciate it? Very, very engaging. And like I said, when we started, I said, I want to take this room electrified, and I'm sure that we're not going to get not anything less than that once Prof starts up with us. And I'm sure that we're not disappointed, are we? No, we are not. So we look forward to more. And so the room is going to be, now that we have taken up. So now we are gingered to work, right? So now, but before we do that, we like to take some group photographs. You know, you are here. Like Prof once told us, he said some people in the academics, they take permission to go out and you don't take pictures. You don't have evidence. And you know when you don't have evidence, what will happen? You go explain tire. All right, so let's go group pictures. And we come from there, we go for our lunch. And then when you take your lunch, just know that you are taking lunch so as to lunch. Is that okay? So we'll launch into the next stage. Powerful pause.
When do we be back?
Okay, so at the restaurants. Okay, so can we take the picture here and then where else outside? I think yes. Outside. Okay. Oh yeah, here is actually the activity start. So let's have it outside. Let's take pictures outside. In the next 1 hour, we will convey. In the next 1 hour, we will convey. Thank you.
supposed to mention the other time that I forgot. How many of us don't have R installed on our laptops? We don't have R software installed. Okay. Please, let's dignify. I don't know. Therefore,
Yes, sir.
Mr. Shikeon, maybe you will back to help us. Yeah, if you don't have R software installed, please signify. Okay. So some of our members will come around you to help you do that. Let's just see. I believe the internet should work fine. So just let's them install R.
Which you say this that very expensive. Which that is the
So don't worry, I believe that this will not distract you. We are going to start right away, but while we are doing this, for those of you who don't have, somebody will help you to install. So once you see any of our team member around, so you just signify that they should help you. But that, please try to ensure that it's not distracting you, so that you can pay attention to what we have to do now. All right, thank you. So the next agenda we have before us is to look at mathematical foundations of malaria modeling. Mathematical foundations of malaria modeling. And this is going to be a time to open our eyes to some of those mathematics you have never appreciated. You know, mathematical concepts you have never appreciated. That's actually from the bedrock. So what we do in modeling, and this time is to open our eyes. What may look fundamental, but very, very strong and important for doing great modeling work. So one of the scholars at Icammda is going to be taking us through that. Now, that would mean that you have somebody you can interact with. You know, sometimes when you have a young person take a class, you can easily interact, right? Yeah. So please, I want us to also ensure that we maximize this time to get as much as possible. Who knows? Maybe this will be the beginning of a great thing for somebody. So join me to welcome the person of Mr. Samuel Oshikoya. All right. Good afternoon. So thank you for the privilege. Yeah, so it's a privilege to stand before us all, and I'll be taking us through.
So we have tried to use that. So because we didn't take the direction in that part. So I want to believe that
So I'll be taking us through mathematical foundation for infectious disease modeling. Mathematics, the mathematical foundations for infectious disease modeling. This aspect is very important in that one of the things we tend to do in infectious disease modeling is this ability to explain biological concepts, biological processes using mathematical terms, and understanding these mathematical terms and how they relate well with biological processes is very fundamental, because one of the things you want to do is, one, how these mathematical terms, how coherent they are in explaining the biological process or processes, as the case may be. So we're going to begin from something simple, then from there we climb higher.
some of these mathematical some concepts, for some of us, we know them, but we don't, we may not know how significant they are as far as infectious disease modeling is concerned. Next slide, please. All right, so this is the overview. We'll look at simple equations, function of time, exponential functions, disease transmission, matrices-based calculus, and also system of ordinary differential equations. Next. So for the simple equation, we're going to begin with equation of a straight line. Equation of a straight line. We all know the straight line. A straight line can be in different form. Straight line can go this way, can be this way, can be this way. But one thing we know is that generally straight lines are generally represented by the equation y equals to mt plus c, where our y and t are the variables, y being the dependent variable and t the independent variable. And you can see a kind of variation that is linear between these two different variables. So the m there is the gradient that tells us the change of y with respect to t, because we have represent y here as a function of t, that is y there is dependent on t. And this is very important for us in modeling, because there are times that there are some maybe aspects of the biological processes that is a function of another thing. For instance, you may have some parameters that are functions of time. And now you want to be able to represent those parameters as a function of time. And one of the things you want to capture is, okay, this relationship or this dependency can it be captured well using a linear function? Because one of the things you want to achieve is that the model you are coming up with, you want to ensure that it is able to explain as much as possible the biological process or processing that you are trying to capture. All right, so no, stay on that slide. So C is the constant value at which the line crosses the vertical, y it that is when x is observed. So now, just a typical example, just to relate it with what we're learning at the same time. In infectious disease modeling, the mosquito bite rate, for instance, in malaria modeling, can be modeled as a linear function. So here we have beta as a function of B, where the B represents proportion of bed net usage. So here now we have represented the mosquito bite rate. This beta max represents the maximum mosquito bite rate. The beta min represents the minimum mosquito bite rate. Now, each of these is just a constant value. For example, we can say the maximum mosquito bite rate, let's say, is 15, and the minimum is, let's say, 1. So that means what I will just have here will just be 15. Then this will be 15 minus 1, which is 14. So that means in the real sense, this would have been 15 minus 14b, right? So, and now, what you have just done is that you have represented the mosquito bite rate to be a function of the bed net usage. Trying to capture the relationship that's okay. Possibly, when we have more usage of bed nets, then the mosquito bite rate will reduce. But when we have less usage of the mosquito bed nets, then the mosquito bite rate will increase. So now, in this sense, what you have just done is that you are trying to capture the relationship between the mosquito bite rate and also the bed net usage as a linear function. You consider it to have a kind of linear relationship. But depending on what you are also looking at, you may want to still dig further to look beyond just a linear relationship. You may want to look further beyond. This is just like a basic relationship between the mosquito bite rate and also the mosquito bite rate and also the bed net usage, because there are sometimes there are some properties of the bed net that may be interested in capturing, which this linear function now will not be able to capture. For instance, now we know that bed net over time, maybe after some years, will no longer be in use. maybe as a result of polls and other things like that. But if you look at this equation, it's not capturing that. So that's why I said it's very important for us to understand, okay, what do I want to capture and which function best capture it is very important for us. Because you have a biological process you are trying to explain, and the mathematical terms you are bringing in must be able to explain better the biological processes that you are trying to explain. Next slide. All right, now we want to look at function of time. So, like I said, there are some parameters because in building a model, one of the things you want to do is that you want to bring in those parameters that explain the transmission dynamics of that infectious disease that you are trying to develop a model that you want to understand. So some of these parameters are constant parameters, while some of them are dependent on time. So now, those parameters are dependent on time. We can make them functional time, depending on what we are expected in looking at. For instance, now, the other time we consider the mosquito bite rate, isn't it? Now, you can make the mosquito bite rate, which was just a linear function which is dependent on bird net. Sometimes you can make it to be dependent on time. So you want to define it in such a way that it is dependent on time. We notion that okay, there is the time of the year where we have more mosquito bite rate. Although you are also still considering the effect of the bird net. So now you have these two things that you want to capture together. So function of time. So the equation y equals to f of t is a typical example of a function of time. And just like I have said earlier, parameters are very key in mathematical models because you want to use them to explain the transmission dynamics. Because especially if you are using deterministic model, which is a process-based model, so there are key parameters that we want to incorporate into the model to be able to explain better the transmission dynamics of that business. So this parameter can be either constant or time dependent. And one thing is that if the parameters are constant, it gives some level of limitation to your model. For instance, if a parameter is dependent on time or dependent on other variables, but you make it constant, all right, that means you have limit some of the things that could have been explained with the aid of the model. And sometimes you make it a constant just to reduce some level of complexity that may be associated with the model. It is allowed. Sometimes you have to give some assumptions to give reason why we are making this parameter a constant. But sometimes if you want to go a bit higher to ensure a kind of trying to come near reality, sometimes you want to make those parameters dependent on time or some other variables, as the case may be. So now we have, for instance, in this model below, we have this is just a simple model, SIR model. The parameters here now have beta and gamma. So those parameters, beta and gamma, they are constants. They are just constants. They are constant parameters. Thus, we say that this model is an autonomous model. It's an autonomous model. When we have a model like this, and all the parameters is dependent on maybe what parameters are just constant, right? So we say that we call such model autonomous model. But if, for instance, now this beta, which is like the contact rate or the transmission rate, if it is dependent on time, then the model becomes non-autonomous. Reason being that one of the parameters is dependent on time. Let's look so let's look at time-dependent parameters. So narrowing down to malaria, we know that we have the seasonality of malaria, and that has to do with the kind of systematic peaks of malaria cases observed annually in our countries. So now, there are drivers of seasonality of malaria that sometimes you want to capture in your model. But here, we have environmental and climatic factors. Among other factors are responsible for seasonality of malaria, and these factors influence the availability of conditions suitable for the sustainability of mosquito population and their activities. And a typical example of it is fighting for blood giving. So now, this seasonal variation can be integrated into the mosquito bite rate as a function of time, which leads to the modification of the bite rate. So the mosquito bite rate is defined as a sinusoidal function. Now, if you see where we started from, the first biting rate I showed us, all right, was just a linear function, isn't it? And if I to look at the linear function, it's just like a straight line, just a straight line. But now, with the understanding that, okay, seasonality is associated with malaria. So all the things we want to look at is, okay, so how do I capture that seasonality?
Malaria is associated with seasonality.
Thank you, sir. Yeah, thank you, sir. Malaria is associated with severity. Yeah, thank you, sir. So, and now you want to look at, okay, how do I capture that severity? So, you are looking at an aspect where you can introduce that severity in the malaria model. And one of the aspects of that model is, or one of the aspects of the process is the biting rates. And what we have here now is a sinusoidal function, giving us something that looks like wave, you know. And this V0 here is just like the baseline mosquito biting rate, which can sometimes some authors use the maximum mosquito biting rate. So this now will be regulated by this sinusoidal function. This will be regulated. We know that sinusoidal function have values from -1 to 1. All right, -1 to 1. This one we have here is just like a controller, and the fluctuations we are seeing here now will regulate this biting rate that we see here. So unlike the previous one where we just have a straight line, this one here now is going to have something that will be sinusoidal in nature. And that is close to what is observed in malaria data. This is analysis. So now, having known that, we can see seasonality in malaria, then we are trying to see that, okay, how can I capture that with the aid of my model? So which part of the model is it that I can introduce these to? Sometimes you want to introduce this seasonality as the mosquito recruitment rates. Going to the fact or notion that there is a time of the year where we have abundant mosquito gives to abundant mosquito recruiting sites as a result of the rainfall. So you want to now say that, okay, that is also seasonal. You want to attach that to that's that you want to attach it to the recruitment rate. So having identified that now, okay, the recruitment rate, the biting rate, I can attach this seasonality there. So it's not left to you. Maybe you want to apply it to both or one of them. Reason being that you're trying to explain what is observed in the data, and you want to represent that mathematically using your model. How would you get that? Please, are we following? Yes. All right. Next. All right. So the other one we want to look at is the exponential functions. Now, while we are looking at each of these, is because we will not be able to cover all, but this because the idea that when we have a process we want to capture, it is very important or paramount to the disease we are trying to capture with the aid of mathematical model. We must be able to ask a question that what function best describe the process I want this my model to describe. Very important. Very important. So we have a function. Exponential function which is for ordinal number and the biology of physical sciences. Phi is defined as phi is defined as the approximate value of this heat. Also, the Euler number raised to the power of any number t is equal to the following expression. So this is just exponential 1, that is Euler number is power 1, exponential 1. This is just the expanded form of it. For exponential t, this is the expanded form of it also. Next. But let's see how we're going to use it. Similarly, e raised to the power of the product of any two numbers, e.g., if you raise to the power of kt, it is also like this. It's just normal summation, fraction, then using factorial. If it is minus kt, it is also like this. Now, this exponential kt and exponential minus kt they have some things they can use. For instance, if part of the biological process or processes we are trying to look at has to do with decay or growth, then exponential function can capture that. When we look at decay or growth. For instance, now, if you are trying to study a particular disease, maybe you are looking at the number of bacteria, for instance, and maybe you are looking at a particular organism that decay over time for us to have more bacteria. And now you want to capture the decay of that organism. We can use exponential function to represent that. Okay? All right. Let's move to the next one. Next slide. So this is a visualization of exponential minus kt at different values of k. This is at k equals to 1. This is at k equals to 0.1. And this is at k equals to 0.05. So these are different values of k. And if you look at it now, at k equals to 1, it's like we have the decay is delayed in a way, right? The decay is delayed, isn't it? Compared to this one where it is very fast. And this one which is sharper than this other two. Okay, next. Then we have the other one which is logarithm. So these are functions. So we have the logarithms. The logarithm of a number n in base b is the power n to which b must be raised to obtain n. Mathematically, it is expressed as the logarithm of a number n base b is equal to x. Implies that n is equal to b raised to power x. So now, one thing is that where can we make use of this? There are times we have noisy data. We have noisy data that you want to transform, or you want to reduce, you want to scale the data. We can make use of logarithm to reduce the noise that we see in the data, and that's what we can include on our R, which will still be introduced to in the course of our meeting. All right, next slide, please. Now, let's look at a typical example of the use of exponential functions. So, for instance, we have exponential functions are widely used in infectious disease modeling to describe the spread of diseases, decay of immunity, growth or decline of populations like vectors, hosts, or pathogens. So, for instance, let's look at immune response and waning immunity. Immunity to certain infections like malaria or COVID-19 may wane exponentially over time. For instance, the level of antibodies might decay. And that decay of antibodies is represented as this now. A of t equals to A naught exponential minus kt. This A naught here now represents the antibodies at the initial stage when decay has not occurred. But over time, the antibodies wane. That's why we have where A of t is the antibody concentration at time t, and k is the decay rate of immunity. So, but over time, the antibodies may wane or decay. And now you want to explain that process. So just like I have shown us in the previous graph, so we have the A naught, which is the initial concentration of the antibodies. But now you are using this to capture the fact that over time it declines, because that's an aspect that I'm trying to capture in your data. All right. Next. Okay, then we have disease transmissions. Early in an outbreak, when most of the population is susceptible, I think Prof told us the other time that at the outbreak of disease, we'll see that the disease grow exponentially, isn't it? Isn't it? It grows exponentially until there's a kind of control, a kind of control to bring it down. For example, in the population of susceptibles, first, if each infected individuals infect R0 others over a generation time T, the infection count grows approximately as I of T equals to I naught exponential half T. So this one here now is talking about growth. It's talking about growth that takes place at the initial state of the outbreak, where R is the exponential growth rate. Exponential growth rates. Exponential growth reflects the rapid rise in cases in an uncontrolled outbreak. So we will see how those simple mathematical terms are being used to describe what we observe in the epidemiology of disease, in the outbreak of disease. So that's why it's very important for us to understand the basic of this foundational aspect of it. So that as we grow to building models, we build models that actually may not be the most perfect, but something close to reality, and which you can explain or answer pertinent questions that are very important to policymakers. Yeah, next slide, please. Now, we want to look at the second one, which is modeling waning IRS effectiveness. For instance, now, IRS is one of the vector control measures, right? It's one of the vector control measures to contain or to reduce the population of adult female mosquitoes. So now, one of the things associated with it is that it's really applied on the wall, isn't it? But over time, it wanes. That effectiveness to kill mosquitoes wanes over time. And now, let's start there for example. Maybe one of the things we are trying to look at is you want to consider the effect of IRS on malaria transmission dynamics. And now you want to use mathematical model. Okay? So now, you are not just bringing in the value of the IRS, maybe just a constant parameter, just put there, and that you are changing over time. No, but now you want to explain the process, you want to explain the process of the IRS. You want to explain the fact that, okay, this IRS, after being spread, it wanes over time. And you want the model to also explain that aspect, because you are trying to capture reality with the head of the model. So now, what we have here is a simple Gaussian function. A simple Gaussian function, which is also a typical example of exponential function that is now being used to capture that aspect. Now, we say, consider the case of modeling the waning effectiveness of insecticidal residual spraying against malaria vector. The Gaussian function, an example of exponential function, can be used to model the waning effectiveness. And what we have here now is the Gaussian function, where A represents the peak value of the function. The peak value of the function, maximum effectiveness of IRS at C equals to B. Now, I want to ask us a question. Let's do this together. I want us to look at the question. I want us to see how this actually represents the idea we're trying to base. Now, we're looking at the effectiveness of IRS. At the point of application, it is at its best, isn't it? Isn't it? So let's say the effectiveness is 80%. So that means at its best, it is 80%. But now we have B, the time at which the peak effectiveness occurs. The time at which the peak effectiveness occurs. Typically, B equals to 0. So I think that the time at which the peak effectiveness occurs, and at that time we say that B is equal to 0. So now, if B is equal to 0 and T is equal to 0, the word of this will be equal to what now? The word of this will be equal to what? 1, isn't it? Reason being that we're going to have 0 minus 0, that is 0. 0 by everything here becomes 0. and exponential 0 becomes 1. And 1 times A here gives us A back, right? So, and what does that mean? And we have said that our A is equal to the peak value of the function, that is maximum effectiveness of IRS at T equals to B. Are we seeing that now? So, meaning now that it's going to have its peak value at the initial stage when it's just applied at T equals to 0. So that aspect now, we have captured it with the head of this equation. Then the fact that it wanes over time is also captured here, because now, over time, we are going to be having this now reducing over time, because we have our exponential to be negative, which means decay, isn't it? This one here means decay. Negative means it decays. Positive means it grows. So C controls the spread of the function, how quickly the effectiveness wanes over time. Then T is time C's IRS application. Now, let's move to the next slide, please. So this is the graph showing that weighting of the effectiveness of IRS. So we can see at the beginning, so if we take, for instance, that at the beginning, the IRS is 100%, for instance. You say it is 100%. That's why we have it here as 100% at the beginning. This is when T is equal to 0. At the beginning, it's 100%. But over time, it wanes. Over time. It wanes over time. It got to a time that it's like it's not even killing the mosquito again. Why? Because the effectiveness has been reduced drastically. And that now has been captured using that Gaussian function. So now, if you put this now into your model, it makes sense in that an aspect of the IRS, which has to do with the way the effectiveness of the IRS is captured in that model. The model capture one of the part of the reality that we see or we observe naturally. Yeah, next. Then we have other important functions. Logistic growth. This is usually used when there are limiting factors for maybe organisms to thrive in a given environment. For instance, now mosquitoes thrive very well when there is a kind of abundant breeding sites. But when there are limited breeding sites, then they will not be able to thrive. And now you want to capture that aspect. You want to look at the fact that, okay, even though the mosquito want to grow so wide, but there are constraints. And those constraints also, you want to capture that in your model. You want to look at their emergence into adulthood, maybe from the immature stage is controlled, or it has a level of constraint as a result of limited resources. Because there are times that when mosquitoes come to a particular habitat and they find out that there are many eggs there, or maybe there are not so much species, it has to find another habitat. Reason being that there are limited breeding sites. And now we want to be able to capture that with the aid of the mathematics. So, and since you are looking at the growth of, looking at the population growth of the immature mosquitoes, for instance, you want to capture that with the aid of the logistic growth meaning. And in that, we are introducing a carrying capacity. So that carrying capacity is what gives the limits. What gives the limits to how large or how big they can go. Reason being that the resources that they need to thrive is not available. They have limited resources. So, and now you are also trying to capture that limited resources in your model, making it more realistic. So, with this, this equation called the logistic growth model can be used to capture that. So, for instance, and not just in that area, there will be some other diseases also. It will be bacteria depending on the biology of this. That's why when Prof mentioned something at time, please, I would really like us to pay attention to that. And it's the fact that for any disease one wants to model, understanding the biology is very key. And I can tell you that it's very, very key. When one understands better the biology of the disease, now translating it into mathematics, why that is not linear in itself. But at the end of the day, when you are translating it into mathematics, you know that what you are doing is biologically correct. And when you are explaining it, even the biologists will not understand all your mathematical jargon, but they are able to see that the reality, your biology of the process has been captured by you. It is very important and pivotal. All right, next. So that this is just the solution of that model. Next. So then we look at matrices. As simple as this is very important for infectious disease problem. Matrices are just mathematical tools used to represent systems with multiple interacting components. In infectious disease modeling, matrices allow us to represent transcription dynamics, study interaction between host vectors and also environments. And we have basic matrix concepts. The normal addition, subtraction, multiplication, inverse of matrices, eigenvalues, eigenvectors. These are very key tools for stability analysis. So matrices, yeah. So definition of eigenvalues and eigenvector. So given a square matrix A, an eigenvalue lambda and eigenvector V satisfy this particular property, that is, our AV is equals to lambda V. Eigenvalues are found by solving this particular equation. Find eigenvalues by solving these equations. As mathematical modelers, some of these things, there are softwares that can also enable us to just solve them easily. There are software that can also solve them easily. But there are times that it's also very, very important that one just have some basic understanding, so that even if anything goes wrong, you know where the error is. Very, very important. Next. Finding eigenvalues. Given this matrix A, for instance, to find the eigenvalues involve computing the characteristics equation. You know, I showed us something in the previous slide that looks like this. The determinant of A minus lambda I. This I here is an identity matrix, which is just 1, 0, 0, 1. So if we place A minus all of that, we are going to have this. So we find the determinant by just multiplying this times this minus this times this. Now, if you open the bracket, you are going to get this, and then equals to 0. So if we solve this now from our quadratic equation, if we solve this, we put that equals to 0, the second also equals to 0. We are going to get lambda 1 equals to 5, lambda 2 equals to 2. And this is very important for us to now go on to find the eigenvector. Next. So this one shows us the eigenvector. Next. And now, use of matrices. It can be used to determine the stability of equilibrium points. The equilibrium point is just telling us where we have time independent change. All right, that's just what the equilibrium point is telling us. And to get that, what we just do is we set each of these, because this one is telling us change. Whether you see the S dt, the high dt, the half dt. What's that the half dt, the this, the that is just telling us. What we just explaining basically is just change. That's all about it. It's just telling us change. For instance, now, just like we are here in this all right, we can quickly do a kind of maybe dHdt, where H represents number of humans. All right. If we look at the class now, the same number of people who were here at the time is not the same number that we have now, isn't it? So it is like maybe, for instance, now let's want to look at dHdt, isn't it? Where H represents population of humans that came in here. Is that what I'm taking? So how do we represent that? Look at it. I'm going to say dHdt equals to, let's say H, which represents number of individuals who come in here. Are you getting it now? All right. Minus maybe alpha H, which represents number of people who goes out. Are we getting it now? So I'm not trying to explain now that, okay, so the change that has occurred in this case now, I have dH dt, which is telling us about the change that is occurring here now, equals to H, which is the number of people who came in, then minus, let's say, alpha H, where the alpha is telling us maybe going out first, for instance. All right? So, and with that, I've just captured that change. So that change now that is occurring, we represent it with the HTT. Are we getting that now? So similarly, All that we are seeing here, the SDT, the IDT, the RDT, is just telling us what happened in the susceptible population, what happened among the infectious population, what happened among the recovered population. That is just what this was happening. Can we check that out? Okay, so to check global stability of the disease-free equilibrium, first we need to compute the DFE, this is disease-free equilibrium of the model. And I said that we are going to do by setting each of these to just be equal to 0. Next. So if we do that now, if we set each of that to be equal to 0, we are only going to have our S star remaining. So we are going to have S star only remaining. All that will become 0, then we are going to have X to be equal to X star remaining. Then what we want to do, we want to look at, okay, to form the Jacobian matrix, we need to compute partial derivatives. Partial derivatives. This partial derivative we are seeing here is coming from the model, actually. It's coming from the model. You know, there's no board there, so one cannot really do many things. So maybe just like Prof mentioned that. Exactly. So one cannot really do many things here. But this is just the Jacobian matrix. This is the characteristic equations. Continue. Next slide, please. And then the interpretation now is this. At the point we have lambda to be equal to 0. So this eigenvalue corresponds to the fact that one of the solutions is steady or unchanged. Then we have lambda to be equal to beta S star minus lambda. The stability of the disease-free equilibrium depends on this eigenvalue, which is this. If beta S star minus gamma is less than 0, then the disease-free equilibrium is stable. Otherwise, the disease-free equilibrium is unstable. So matrices are indispensable in infectious disease modeling, offering compact and computationally efficient ways to represent complex systems. It's very important, it's very key. So combining matrix method with computational tools allow for powerful analysis of transfer dynamics, stability, and also intervention. Sometimes you want to look at the effect of intervention, maybe on the particular, for example, now we talked about RS last time. Sometimes you want to look at airline, sometimes you want to look at treatments, and sometimes you want to look at maybe intervention like the essence, just like it was discovered there. Next slide. Yeah. Then we have basic calculus, derivative of functions, and some of their properties. You know, calculus, I don't know if you see over our dy dx, and just like I have told us, basically, it's just talking about change, as I've said. Change of a dependent variable with respect to an independent variable. Why with respect to x? And all of that. Next. So then we have differential equations. So like the model I showed us that I was using to explain the SDT, the IDT, the RDT, we call them differential equations. Typical differential equation. But you will see that one now we have the SDT, the IDT, the RDT, right? In mathematics, we call them system of ordinary differential equation because they have a kind of relationship. Next as we random. So the system of ordinary differential equations. It can be linear, it can be non-linear. And one of the things you use this to do, just like in the case of malaria model, what do you do? You look at the whole population and you compartmentalize it. Isn't it? So okay, susceptible, the exposed or infectious class, the asymptomatic individuals, infectious individuals that are symptomatic, and then so you look at that, and then you want to look at the change that occurred in each of them and also how they relate. And we'll see that there's also transition from one population to the other. So you use a system of differential equation to capture that change. Next. So I think now application of differential equations, it can be used to predict outbreak dynamics that like Prof has told us. It can be used to evaluate the effect of interventions and also understanding the community thresholds. So now, very important is for us to understand the biology of the disease. And very important also is for us to understand the aspect of mathematics function that capture the process we are trying to explain with the help of our model. And the purpose of doing this is for us to capture reality in order to make good prediction. And as we do this, we can make Nigeria a better place and also a malaria-free country. Thank you for listening.
All right, so we have to Mr. Oshikoya presenting to us some very important mathematical concepts needed as tools as we go on in modeling. I also know there are one or two questions that we may want to raise, asking, maybe or clarifications you want to make on something he has said during the course of his presentation. So I'll give number one. Okay, number two. Okay, so we have two. Okay, it's number three. Sorry about number seven. All right, so please pay attention to the online participants in case we have anybody from that end wanting to ask a question or make clarifications. All right, you are the first one.
Thank you very much for the explanation. I really followed along. Apologies, I may take you a little back because I know I'm not the only one that needs some clarification. Now, when we are looking at models, we have machine learning models, we have statistical models, we have mathematical model. I'm actually familiar more with machine learning model and statistical model. I would like you to just throw a little light on some mathematical model, like giving example for clarity. Then for the explanations you give into, you gave different forms of distribution. For the exponential distribution, it's very, very clear. A kind of outbreak response normally take an exponential curve or exponential function. So if you're dealing with that kind of prediction or forecast, you need to use an exponential kind of. So I want you to, if you can give an example of the other functions like the sinusoidal function, which scenario do we use them and all the rest. Thank you very much.
Okay. So the first question that has to do with mathematical models and machine learning models. Just like Prof said the last time when he was presenting, machine learning models are more black box models. You have little you can do. Let's take for instance, I just explained the concept of weighting effectiveness of IRS. The weighting effectiveness. Now, if I to use machine learning model, you can't capture the weighting effectiveness of IRS using machine learning. Now, when you develop a deterministic model, which you call the mathematical model, for instance, the aspect of the mosquito, because malaria is we have heterogeneous population for the human part and the vector part. Then the model shows you the interaction between both of them. Now, in explaining the dynamics of the vector population, now one integral aspect we are bringing in now the effectiveness of the IRS. Now, that transmission dynamics, you can't bring it into machine learning model. What you do with machine learning models, for instance, you have the targeted variable, then you have the predictor variable. So sometimes you are looking at, okay, you have bird nets, you have climate factors, maybe rainfall, humidity, aridity, and temperature. Then you want to see ahead. And so you want to see how these influence this. So, but in the long run, you're not really capturing the transmission dynamics. You are only seeing the influence of this on this. Now, the machine learning may help to understand which factors influence which. But in now capturing the transmission dynamics, which is very important to us or important to policymakers, all right, then you need to make use of the deterministic model, which help you to explain the dynamics and also bring in the effects of the control intervention and also the properties associated with the control intervention. For instance, we only mention IRS. If you want to look at LLIN, for instance, there are certain things about LLIN that you want to also explain in relation to the transmission dynamics of malaria, which with the aid of machine learning models, you may not be able to. The only thing you will able to do with machine learning models, okay, maybe you are looking at LLIN, for instance, and you want to consider, okay, what is the level of coverage in a particular given year, and you just put in that. But mathematical model will help you not to only have the level of coverage, But what's happened over the years with that level of coverage, which machine learning cannot capture? I think that one is well understood. All right. So then the second one has to do with can you imagine that? Examples of okay, yeah. So there are other functions aside exponential function. For instance, now we make use of quadratic functions. Let me give you an example. For instance, now if we want to look at, let me say, mosquito bite rates, let me say use mosquito bite rates. There is the given temperature where the mosquito bite rate is very low. Reason being that the mosquito activity at that temperature is very low. So biting rate at that time also is very low. Now, there is also a range of temperature where mosquito biting rate is very high. And also there is an extreme temperature also where the mosquito biting rate is also very low. So now, how do we capture that? If you look at it now, the way it goes from here, up, and down. And if you look at it, quadratic equation captures that. Or a parabolic function captures that. Are we together now? So that now can be captured using quadratic function. So that's just a typical example aside exponential function. Then this notion that you also mentioned, you have waves. You look at the malaria data, you can see some level of seasonality, and then you want to capture that with the aid of sinusoidal function. We have other functions with which you can also capture that. So that those sinusoidal just happen to be like one of the basics to capture that. Thank you so much. All right. Thank you so much. So let's have the second person.
Thank you so much. Good afternoon, everyone. Apologies, I came in late. Permit me to speak like the non-academic. So clinicians here. So I'm glad the questions on that. I came up with that linear equation. I'm like, oh, Father God, it has come again. And then it ended up with divide here. So we can't run away. So fantastic thoughts, right? I like the idea, coming from Prof's conversation earlier, that you need to understand the biology of this before you go into the. And I also recall that during the launch, a short conversation with Dr. Oresta just reminds us of the fact that the future is modeling. Now, coming and putting all this home, right? I think again that bridge between the modelers in this room and the decision makers for the malaria interventions out there, we need to be fast as regards building them. I mean, bridging that bridge. And I see some of your equations are quite understandable again, because maybe because I've seen them, some of them before, without reference to biology. And I think it will be very useful for us to feature very simple, I will use the word simple with some sense of respect, right? Simplified presentations during each of our subcommittee meetings. I know we see your team make presentations during the case management, the SMEO, the M&E subcommittee meetings. Sometimes you get scope script, sometimes you're just like, when will they stop? But I think we need to sit back and design with the national program some specifics as regards, introducing the concept, because this is the future. I mean, there's no how we can escape it. I was just telling my professor that the mosquitoes bite me when I study now, and I wonder where they are. I think I may start using sniper because they are defining of normal insecticides, right? So the entomologists are then telling us so much of the stories about the biting rate, outside biting rate, inside biting rate. Can we begin to put this forward. And I think this meeting is one of those kinds of meeting. I've asked some of my colleagues from the, by the way, I'm from Solina Center for International Development Research, but I've asked some of my colleagues from Nmep are here. I don't know who is here. I want to have that person so we can have some critical conversation, in accordance or in addition to what Dr. Russell and team are doing in Malaria Consortium, and since have a sit down with the coordinator on how to prioritize this. We've seen some of this happen in some of the projects we are all doing, that's modeling, but we need some indigenized form. And I think the organization stands to do that very well. Now, coming on to your presentation, finally, I'm not sure if I missed it, which equation really addresses controlled outbreaks? Because I saw you showed the exponential equation that applies to uncontrolled outbreaks. Is it the linear? Or which? It will be useful to hear you speak to that. Then I think I saw which controlling in slide this. You can go back a little bit. It's a bit of question before we began to have ETC, end of thinking capacities. I think it was where you were speaking to IRS. Okay. Where you spoke to the negativity of your equation. Yes, just before that. Exactly. Thank you so much. So my question is, why is that negative not outside the bracket? Because if indeed it's a negative, you're looking at the decrease in potency as we go of the insecticide. Why is it not outside the equation? I mean, it's very late, right? But it's very important to understand. These are the kind of understandings we need to start having in understanding the complexities that you put out here. Thank you so much.
All right, so as regards why this is one thing that there are two ways to represent exponential functions. For instance, how to write exponential. For instance, now we can use just E. So if you're making use of E, for instance, we just write E raised to a minus, then we open this bracket and write just the signs. But because we have used ESP to represent that exponential, so whatever equation we want to put, we put it in that parenthesis. So that's why this minus is coming in as 20. Yeah. Yes, it's still set.
Okay, but you raised a very critical point the other time. I wouldn't know if
I want to do that to probably for profit make correct.
Yeah, so like in controlling an outbreak, so the targets can be depending on the kind of control you want. Like if it is vaccination, primarily the target will be the population that are susceptible. Primarily. But for COVID, it was not the case because so it was a special case. So now we target the susceptibility to vaccination. Now, and then that vaccination also has different kind of not outcome, like different methods or approach, because like you can have a perfect vaccine, and then some vaccines may not confer immunity. Those are complexities again. Yeah. So you got so that you take the two vaccine does not mean that you end up being immune to that disease. So all of this has to be factored into that, depending on the kind of data you have. We also give you the kind of information you feed into that model. Now, if I'm also looking at, take for instance, I'm looking at NLI now. I'm factoring NLI into the model. Now, when do I need NLI? I need NLI at the point of biting. So I factor NLI at the point of transmission, contact. So where I factor NLI will be when the mosquito is coming into biting. So that's at the transmission time between the contact time. So when there's going to be transmission, I factor N line. So the N line is a limiting factor to transmission. So that's for N line. For which other ACT? For ACT now, I factor in into that's infectious class, infected and infectious. Somebody who is already showing symptoms, who have been tested and then he has been tested and then that we confirm that it's positive. So and then he's given ACT. So that ACT is to reduce the class PF in his body and all that. So we factor that into the infectious class. So to reduce that. So and then which other one do we have? I've mentioned that. Okay. So I think that's so that's the range.
I think from prevention.
Yes.
Prevention and treatment. So they have different equations of course, because the rate of degradation of the agents differ across, and what you are targeting in terms of defining that matters. So again, this brings me forward what I was trying to say earlier. I'm going to remove my shoe. That's really, I think we need to think deeply and very fast in applying what we are all doing or what we're speaking about here. The decision makers apply to a large extent the approach of what we call one cap fits all, even within those categories. Whereas it's not supposed to be the case. There's a new fad of applying the subnational tailoring and all that the WHO team are doing. The organization is also involved in part of that. And I think we need to begin to bring home some of these equations to be more specific. Because again, I think as modelers and as mathematicians, we also know that an equation cannot apply to all.
Yeah, of course.
So it means within even each category, we need to define by location, by the epidemiology and the entomological characteristics of each geographical location, the equation that serves the purpose so we can address the issue. Of course, adding in other factors. I mean, just putting it out there, you may not have an answer for that, but it's just food for
yes. Thank you. So see that I showed one of our papers on KB states, LLI, modeling for malaria in LLI. So you find out that one thing we notice is that that is even state level and local government level, they are also finding out KB states. We found out that there are variations even between local government with this same state. There are variations that goes on within the same state. Yes, so and local government with the same state. So we find out this kind of situation that you mentioned.
So okay, so one of the things are very critical point you mentioned. I think the Amari individual decision makers and all of that, and I think like you said, maybe probably want to talk about that. Yeah, truly the synergy between the academic and the decision makers, particularly. It's true that we come attend some of these new things, and so I think you mentioned something very important, Professor, that some of these programs should have a unit that has to do with research. So that bring in modelers who will be able to interact, together, with the people on the field. People are going to the field collecting data and all of that, and people are out there also doing their modeling stuff, not having interactions. I think it would be nice what Prof suggested the other time. If that kind of thing is adopted, that in our national body we have a unit, which looks at research and then brings in modelers in that, and then along the thinking way, the modeler is already in the process. So, and then the data collection is not outside of him, and so when the whole thing is done, it helps build a better model to make a decision. I wouldn't know if that.
Okay, sir. All right, thank you.
All right. So the last question.
It's the logistic model. The answer something there. I want to know the equation. Okay. Logistic model. No, it's not logistics. Minnesota.
Okay. Oh. Yeah. Yes,
It's all fine. What is it? I don't really.
it's okay.
Yeah. Fine. The explanation for that, I know that the sign function there is making the one and the spy that is making it to look so that for that fine.
That fine. That fine. Please sheets. Yeah, that's what it's will be now and do regular screen. That's what it's that give rights to machines.
Thank you. Then I think the material for this program will be given to us. All the material.
All right. So, has he answered the question? Okay. Do we have any online participants with question? All right. So, please help me appreciate Mr. Sam for that beautiful job done. Okay. So, at this point, I would like to say that we may not necessarily have followed exactly the way the program was written. One, because we started a bit late, and we're now trying to see also the flow of activities. And so that's why we may jump some, not because we not still do them, we do them. So for today, wherever we stop today, anyone we are not able to handle, that by God's grace tomorrow we start from it. Particularly the R and something, you would do it. So we cannot leave this place without doing it. But then I want to go into something very, very important now. Mr. Sam has just given us a kind of panoramic view of mathematical functions that we can use. We use in modeling. But now it's important for us to begin to look at case studies of where we look at modeling the spread of malaria, particularly we look at some kind of real-world example of malaria modeling, where some of us who are not in the academics will be able to see the beauty of the conceptual world being brought into the mathematical world, conceptualize something, then you break it into mathematics, and then because it's from there, you are able to also bring in the reality, which is the data, and then you translate back to real life. So let's even see how we conceptualize these ideas in mathematics. How do we conceptualize this idea in mathematics using case study so that we'll be able to see? I also have the honor of bringing one of our PhD scholars on board to discuss this, modeling the spread of malaria. We have with us Mr. Obojuri, who will be taking us through that. Please join me to welcome Mr. Shi. All right, yeah.
Thank you, Mr. Adu. Good afternoon, everyone. So we'll be continuing where we stopped, looking at modeling the spread of malaria. But before we looked at how to model the spread of malaria, we'll quickly look at a simple compartmental SIR model. Slide. So a simple compartmental SIR model. Now, compartmental models divide the entire populations according to infection status. Say if we have, if we take the participants in this place as a population, we can divide us according to our infection status. And so we have for this case now, we have three classes. We have the susceptible individuals, those that they don't have the pathogen in them or the parasite, they don't have the parasite in them, but they are capable of contracting the disease. We also have the infected individuals, infected and infectious individuals. These people, they have contracted the disease and they can spread it to others. And then we have the recovered individuals, those that they've recovered from the disease, and in this case, there is no reinfection. And models like this make sense for, say, childhood diseases like measles, like chickenpox, where after recovery, you have permanent immunity. Is that clear? So models, simple SIR models like this can be used to model such disease, such childhood diseases. And so an individual's move between compartments through firstly transmission. When a susceptible person comes in contact with an infected person, that person gets the disease and then transits to the infected class. And after the infectious period, the infectious individual can recover and move to the recovered class. Exactly. So let's see a simple as how do we develop simple malaria models? And one thing that has been emphasized in this program is for you to develop an accurate model, you must understand the biology of that disease. Understanding the biology of malaria is a key step in developing any model on malaria. It has been emphasized by Prof. Mr. Sam to emphasize it. If you don't have a good understanding of the disease you want to model, you will be modeling wrongly. You will not model accurately. If your understanding of the disease of the biology of the disease is wrong, your model will be wrong. Now, in developing models, we make simplifying assumptions, like Prof mentioned when he was said the real life is complex, and then but to model you need simplifying assumption because your model cannot be as complex as real life. That there are some models, if your model is even much more complex than the real life, know that there's problem. So the real life is a complex system, and so to model we need simplifying assumptions. Otherwise, our models become intractable. So model assumptions are a set of simplified rules or conditions used to represent the complex dynamics of disease transmission. They help us to simplify complex real-world dynamics to make the models tractable. So in developing simple models, malaria models, firstly we say we must have an understanding of the biology of malaria. And then we also make simplifying assumption. Next slide. So let's see, understanding the biology of malaria. Let's try to see, go through the biology and the epidemiology of malaria. Firstly, the mode of transmission. How is malaria being transmitted? How? With fellow human beings? With what? With let's be specific now. Infectious female Anopheles mosquito. Is that clear? Mode of transmission: when an infectious female Anopheles mosquito bites a human being, there is probability that infection can occur. Malaria can be transmitted. So we need a good understanding. We need to know the mode of transmission. The mode of transmission for malaria is different from COVID-19. So if somebody does not have doesn't know how malaria is being transmitted, if he thinks, say, malaria is transmitted by just contacting another person, what happens to and the person decides to put down a model? What happens to such model? It's totally wrong. It's a faulty model because that person does not have. That's why understanding the biology of a disease is crucial in developing accurate models. So we have said that the mode of transmission for malaria is when an infectious female Anopheles mosquito bites a person. And then the mosquito too can also get a susceptible mosquito that does not have the parasites in it, can also get the parasite from human. Do we know that? That mosquito also catch the parasite from human. So we need to understand that. So secondly, latency period. What's latent period? Who wants to help us? What is latent period? Latent period.
Period between biting and exhibition.
Yes, the period between when somebody gets the infectious bite, and when the person becomes infectious.
when it's now capable of transmitting the disease. So what's the latency period for malaria? Yes, about 9 to 14 days. That's right. So we need to know that because it's going to help us in modeling malaria accurately. What about the most vulnerable population for malaria? Women and children. So if you want to model malaria accurately, you may need to model or develop an age-structured model that has, say, the women population, children population, and then the pregnant women. That's right. The pregnant women population, children population, those most vulnerable populations. So for you to be able to capture malaria accurately, you may need an age-structured model. Now, does recovery confer lifelong immunity for malaria? If you recover from malaria, you can't get it again. Huh? No, unlike measles that we mentioned earlier, that it confers lifelong, permanent immunity. But for malaria, like Prof said earlier, recovery from malaria is pseudo recovery. You don't have complete clearance, parasite clearance from the system, so it does not confer. So those are one of those things we need to incorporate into our model. In fact, when someone is infected with malaria, can it lead to death? Yes, it can lead to death. People die from malaria, especially children. So we need to also capture that in our model. Is malaria epidemic or endemic disease, especially in sub-Saharan Africa? Is it endemic or epidemic? Is both in sub-Saharan Africa? Say Nigeria. Okay, let's look at Nigeria. Close to us, we are in Nigeria. Is malaria an epidemic disease or endemic disease in Nigeria? It's endemic. Epidemic are short outbreaks that just happen within a short period of time. But epidemic disease persists for long, and malaria has persisted for a long time in Nigeria. So malaria is an endemic disease. Now, the way you model an epidemic disease is different from the way you model an endemic disease. That's why you need to understand the biology, the epidemiology of any disease you want to model. Just like Prof mentioned earlier, the way you model macroparasitic disease are different from the way you model microparasitic disease. Malaria is endemic, so when we want to model malaria, we won't model it like an epidemic disease. For instance, in epidemic disease, because they are short outbreaks, we need not incorporate demographic factors like death, like births. We may not, but when we want to model diseases like malaria that are endemic, they persist, they are with us in the population. You need to capture death, natural death of humans. You must also capture the death of mosquitoes. You must also capture inflow into the susceptible population, say through birth, through migration. What about asymptomatic infection? Do we have it for malaria? Do we have asymptomatic infection for malaria? Yes, and it takes a large chunk of malaria infection in sub-Saharan Africa. In fact, it's one of the reasons why elimination has been difficult because, like it's been said earlier, 80% of malaria infection is asymptomatic. So some of these facts about malaria, the biology of malaria, is what we need when we want to model a simple model malaria accurately. So let's keep some of this in hand. Next slide. So we want to see a simple model for malaria. A simple malaria model. Next slide. So this is simple malaria model. Let's look at it. We have the susceptible humans, SH. There is recruitment into the susceptible class through birth. Children are given birth to, and then they are susceptible. You know, the first 6 months of childbirth, children, they have that maternal immunity in them, is it not? So they still have that immunity there. So susceptible humans can move to the infected class. People in the susceptible class can migrate or transit to the infected class through what? How do people become infected? When there's what? When there's an interaction within the infected mosquitoes, there's an interaction there, and then susceptible humans transit to the infected class. Originally, they were susceptible.
they do not have the pathogen in them, but then they come in contact with an infectious mosquito, and the infectious bites led to infection, so they move to the infected class. Now, after the infectious period, so they've completed the infectious period, and then they can recover and move to the become recovered. And that's also what they can also have immunity can wane, and then they return to they become susceptible again. We also have for susceptible mosquitoes, the mosquito population. We have susceptible mosquitoes. Susceptible mosquitoes come in contact with infected humans. Can we see the arrow? Infected humans or susceptible mosquitoes, they come in contact with infected, and then there is transmission. So susceptible mosquitoes also become infected. So this is simple malaria model. Now we also have natural death, because we said malaria is endemic. We capture demographic factors like natural death for each of the populations, each of the classes. Now for the infected class, because we mentioned earlier that people can die from malaria. So we have natural death, which is common to all, and then the malaria-induced deaths. So this is simple malaria model. Now we have made some simplifying assumptions. This model is very simple. It does not capture the dynamics, the complexity of malaria. It's quite simple. We have made some assumptions. Now, can we identify some of those assumptions we have made? Some of the simplifying assumptions we made for this model. Yes, I want response. What are some of the assumptions we have made to simplify this model? Because this model is too simple to capture malaria dynamics. For any policy-driven work you want to do, you can't use this model because it's too simple. It does not capture some of the things we mentioned earlier. So can we identify some of the assumptions we have made? Anybody? Let's identify some of the assumptions we have made for this model. All right, sir.
Okay. One of the assumptions made for this model is the fact that malaria is transmitted singly by the bite from an infected and unprotected people. Meanwhile, there are other means of transmission of malaria, including mother to child with the placenta, and also rarely blood has been for malaria in some rural centers. So blood transmission too with an infected blood can also result in infection by malaria. So if we are like designing a model that captures only the bite of female Anopheles mosquito, we may be skipping the other routes or route of transmission of the malaria, thereby making our accuracy not up to 100%. Thank you.
All right, sir. Okay, but then, yes, there could be other routes for malaria infection aside bites from mosquito. But then the one you mentioned, say blood transfusion or blood transfusion from say they are quite rare, and then we can neglect them because it's very rare.
They are negligible.
So we can they are negligible. We can neglect such transmission routes because it's quite rare. Is that clear? All right, sir. So, yes, sir. Is that an assumption that humans can also transmit to mosquitoes? Is this an assumption? It's true. It happens. It's reality. It's the reality of malaria. Mosquitoes can also get the parasite from an infected person, an infected individual can also transmit the disease to the mosquito. So that's not an assumption. It's actually in our model. So can we identify some of the assumptions in this model? Let's look at them. Let's look at it. We listed some of the biology of malaria earlier. There were so many things that we mentioned earlier that we did not capture in this model. There is no age structure, like I mentioned earlier, that to model malaria accurately, you need an age-structured model that would target the vulnerable population. Say, population of children, we can have this population, say, for children, and then we also have for adults or for pregnant women. That's an age-structured model. So this is not an age-structured model. So that's one assumption we made. What else we are price of?
It suggests that once you get beaten
Yes.
by infected,
Yes.
you must end up dying, right? So there needs to be some taking back to the fact that you get infected, get to recover, and then come back to become successful. Yes, so this that's interconnectivity.
They are legal. Okay, maybe it's a simple one. Or huh? Okay. So let's mention one before we get to that place. Now, one of the assumptions we've made is that we have assumed that immediately the mosquito, the infectious mosquito bites a human, that person immediately becomes infected and infectious. The person immediately moves to this class, the infected and the infectious class, the I class. Now, is that true for malaria? We talked about the latency period. That's about how many days? 9 to 14 days. So to accurately capture that or to accurately model malaria, you need to incorporate that pre-infectious class where there is a lag, a latent period of about 9 to 14 days. Is that clear now? So that's one assumption we have made for this. We have neglected that particular class, which is very important in modeling malaria, because you don't immediately get the disease when, or you don't immediately become infectious when you get bitten by mosquito. What other assumption have we made for this model? What other assumption? We didn't also, beautiful, we did not include the asymptomatic class. And we said the asymptomatic class constitutes what percentage? About 80%, that's quite huge. But we didn't include so it means is not going to flash. What assumption have we also made? Now we've also made an assumption on the recovered class. We've also assumed that once you recover, that you can no longer get infected. Once you recover, we have made that assumption here, but in reality, it is not true, especially for Plasmodium falciparum malaria. Yes, we mentioned earlier that it's just a pseudo recovery. And so once you recover from Plasmodium falciparum malaria, you can still get infected when you are exposed to mosquito. You can still get the disease. Exactly. So we have made an underlying assumption here that once you recover, you cannot get infection again from those in the recovered class. So that's another assumption we have made. But in reality, if you get the disease, especially if you get Plasmodium falciparum, you are still vulnerable. You can still catch the disease. And then we also brought from recovered class, immunity wins, and then people returned here. So this is a simple malaria model with some simplifying assumptions that we made. Next slide. Okay, so here I tried to introduce the mathematical notations that we use, the same model, but on the right-hand side, we have the mathematical, what is going underneath, the mathematics of what we have there. So we have transmission there, and that's term there. Those terms are describing the transmission that is happening, and then recovery is denoted by alpha there, and natural death is denoted by mu h. Natural death plus malaria-induced death is denoted by mu h plus delta h, and also for the mosquito compartment or the mosquito population, we also have the force of infection given there. Next slide. So now, we are now relaxing some of the assumptions. In this particular model, we have relaxed some of the assumptions. We have introduced, what have we introduced here? we have introduced the pre-infectious class, the exposed class. That is, there is a lag, there is a time lag for about 9 to 14 days that people, so when a susceptible human is bitten by an infectious female Anopheles mosquito, the person does not immediately become infectious. There is a lag of about 9 to 14 days where the person, the parasite moves from, say, at the point where the person is being bitten up to the liver stage, and then the blood stage when it starts showing symptoms. So we introduce the pre-infectious class, and our model is becoming more complex now. So because capture reality. Now, pre-infectious humans, and also after completing the 9 to 14 days, they can now become infectious and start transmitting the disease to malaria. And also they can also recover, and after some period, immunity wanes, and then they become susceptible again. And we also have for the mosquito compartment. So we have an SEIRS-SEI model. So this model is still is still with its own assumptions. Every model is limited by its assumptions. Every model is limited by its what? So this model still has its own assumptions, only that we have introduced the pre-infectious or the exposed class. Next slide. Okay, so we want to see how to build a model to understand the potential implications of combining ITNs and IRS. Let's see how. Okay. All right. So maybe what we'll do is we would form groups, and then we'll develop simple models, and we would start implementing or incorporating some control interventions into our model. So maybe that's what we're going to be doing now. We split ourselves into groups, and then we see how to develop simple malaria models, incorporating some key interventions like LLIN, ITNs, ACT, let's name it. So maybe that's all. Let's do that now. So we'll be doing that in the next 15 to 20 minutes. So we'll work in groups to develop simple malaria models. We develop models incorporating asymptomatic individuals and ACT treatments. Another group will develop models incorporating asymptomatic individuals and vaccination. Then a third group will develop models incorporating asymptomatic individuals and SMC. So how do we, let's put ourselves in groups. Can we form numbers, give ourselves numbers? Or should we let's take questions first before we go into groups. Let's take 1 or 2 questions. Any questions so far? Is there any question? So maybe we can go for let's put ourselves in groups. Number 1, number 2, 3, 1, 2, 3, 1, 2, 3, 1. Sir? Okay. 1, yes, 2, 3, 1. All right, so maybe group 1, we can come this way. Group 1, let's come this way. We want to develop simple models. Group 1 can come this way. Group 2, group 1 should come this way. Group 2 can stay at the last, group 2 can use the last seat here. And then group 3 can stay here. Group 3. All right, so Mr. Sam, you help us handle group 1. Group 1 will be working on incorporating asymptomatic individuals and ACT treatments. Group 2, Dr. Afis, incorporating asymptomatic individuals and vaccination in our models, while group 3 will develop models incorporating asymptomatic individuals and SMC. Group 2 are over there. So in the next 15 to 20 minutes, let's develop such models. Huh? Group 3, I'm coming to group 3 now. Mr. Sam, group 1. Did they show us? No, they showed us. You have
I see people to be
show that model. Okay, wait. Show all the so that the child so we can see. Go.
Hello. Check.
Yeah, this. Okay, I think this one.
Check.
Check. Can you see that? Yes, this one. What about the one? Anyone you want to use?
They're not going to.
This is another slide. Mr. Steve. Next.
Okay.
I think for this. Okay. Okay. Right. So, let's. But you can check the way how it's happening. What do you think? And then
yeah, so different. So this screen how the one you do because you really need to screen
I don't think I'm. How you doing? She wants to submit to you. Oh, she gonna tell since. Oh, there's what time is it?
Yeah, right.
I think the base first was this informative okay, so why the other one was it? I came back out and they out chat. This means the this device we meet. How's it going?
I need to write down.
Huh?
Yes, sir.
He said our online participants included in the group exercise. That's the question that they are asking, sir. Online participants. I've replied, sir. Yes.
Let the enter for this one. If you stay too long there.
The ACI was one man was already shaking. When we were coming, the flight, the AC was coming down. Oh, already. Ah.
Only can you Mr. Stephen ba? Báwo lára yín wà ní? Ojú yín ti pọ̀n. In latest lesson, ṣé máa lo ilé ọjọ́ náà sí ìlú rẹ̀? We'll try to reach out. We can bear about again. This is like we wanted that Mariano was the Mama Winnie. So I think it's on Friday. Since we have been on so take it on Friday and stuff. One thing.
Although sometimes all that maybe design those ones like some of the things where
That's what they are just one divide, but also one, maybe like nothing else. Yes. It's about
think that we have got to this point. I know we have been distributed into 3 groups, and some people also online try to know what they are. So let's just take about the next 10 minutes and we call it a day. Okay, we take the next 10 minutes and we call it a day. Actually, what we want to have somebody from your group just come in the next 1-2 minutes to tell us what you brainstorm on and what you came out with. Now, just to say, okay, this is what we came out with. Finally, this was something like that. Okay, so can we have from group 1? Somebody from group 1? Who wants to represent your group? So let's see how you reasoned and what you came up with. Okay, I'm going to choose one. Right, we step it together. This is the last line, so that you. So we divided the whole population, for the woman population, we divided it into 6 class. This compartment, the compartment, we have the susceptible woman E, H, AH for the what we are told to do, and we have the IH, the infectious, and for the ACT that we incorporated, we use TH to denote that. So then we have the RH. So the SH moved to the EH class. Then from EH, there's a progression to AH. Then from AH, we have another progression to IH. Then from IH, we have the treatment. That's a treatment to the TH. From treatment, we have the recovery to RH. Then there is a transmission. Okay, for the mosquito, we have the population of the mosquito is divided into 3. We have the SM, EM, and IM. With transmission from SM to EM and progression from EM to IM. And there's transition between IM to SH, and also a transmission between AH to SM and IH to SM. And we also assume that for each of the recovery class, the possibility of them moving back to the susceptible woman back, and also we have from EH directly to the infectious class instead of moving from EH to AH directly. So that's the model that we have. All right, thank you so much. Can we appreciate him? Okay, now a quick one from what you have shown us here. That means you created a class of people who have been treated with ACT, right? It's a good one. It's actually a good one. So, okay, but I also heard you saying people move from EH to AH, from AH to RH. Is there a possibility of moving? Because do we have also movement from EH to RH? Okay, good. So that's a beautiful one. So can we appreciate group 1? They have done a beautiful job. So they have created a class called the treated class. I think maybe those are the treated class. So let's have which group is it? Group 2, who is representing you? Just in the next 1 minute, you will tell us what you have done. So we introduced the asymptotic asymptomatic compartment. Vaccinated compartment. So we have SEIR, SEIRE. So your vaccinated compartment, now those are people who are being vaccinated. Where are you getting them? Where are those you are vaccinated? So we are vaccinating susceptible okay, yeah, vaccinated. And we assume that these vaccinated people can come to the school. Why? Yeah, why?
Because they are vaccinated already. Yes, the Azonti, people in the vaccinated compartment, they can respond to you. But what you immune, why? What do you call that? I'm sure that the person that has raised this out said something like that. Because you just said that. Why do you say that? Based on what you do about vaccine, malaria vaccine, what do you think about it? I've said a lot here. And you are not yes, life long immunity is one, but it's really not. What did I say about the efficacy of the vaccine? Is it perfect? Still perfect. So what did I say? That we are, as far as I know, I don't allow your spread of the info up to 100. The person is bringing you out. I've said a lot about the vaccine. All right, you know that means it's not the perfect, right? Yeah. So there is a possibility of still getting it. There's a reduction. So the vaccine does not win. People that are in vaccinated all the time. Perfect. It is not perfect, it's why you can get it. It is not, does not compare life loss in what the God wants to God in. They can win and they can become, let's say the bad. It's okay, they become not that again. That means that you can have the movement back to him.
Let me look for the. Sir? Yes, no, yeah. Sure, good.
I didn't know not all that.
Actually, you cannot see the person. All right, thank you so much. So you see now that you are not just
for sure. Anyway, sorry, black.
You are acting.
Sure.